कटिंग वाटर कौन पिएगा? ग्लास बाहर रखे रखे सर लाओ खुला ही रखो, ये ऊपर ऐसे ऊपर रखो मारो। अरे मम्मी ऐसे रखो वो हाँ तो दिखे कि देख वाला है समझे। हाँ वो रखना है तुम्हें मंगाओ भी लेके आना और ऑडिट को WHO वाला साल जिसको है गेस्ट और ऑनर दोनों को हेलो वो तो बंद करेगा। हेलो नहीं करना था मैं इसका यही। हाँ 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 तो अभी कर दो। हेलो डॉक्टर सुभाष सरकार।
हाँ नमस्कार नमस्कार जी।
यस सर आई एम डॉक्टर अनिल नायक।
हाँ जी अभी ये जो
थैंक यू
मीटिंग
फॉर
चल रहा है
ज्वाइनिंग सर।
ये IMA का मीटिंग है ना इंडियन नर्सिंग काउंसिल का। हेलो हाँ नमस्कार डॉक्टर नायक।
गुड आफ्टरनून
डॉक्टर नायक कैन यू हियर मी?
नाउ वी आर starting our program. As you know, we all the Indians have a tradition to start with the prayer. I pray that Sarve Bhavantu Sukhinaha, Sarve Santu Niramayaha, Sarve Bhadrani Pashyantu, Ma Kaschit Luk Bhag Bhaveta. Om Shanti Hi, Shanti Hi, Shanti Hi. May all the sentient beings at peace. May no one suffer from illness. May all see what is auspicious. May no one suffer. Om Shanti, Shanti, Shanti. Now I request our Finance Secretary Dr. Sitish Bali to come on the dais and escort our Dr. Abhija Seth, Chairman of the National Board of Examination. I request Dr. Veena Agrawal to be on the stage, Chairman of Action Committee of IMA Headquarters. Now I request Dr. Sahajanand Prasad Singh to escort Country Head of WHO, Dr. Rodrigo Offrin. Now I request our worthy President, Dr. Sarad Agrawal, sir, to escort our today's chief guest and Minister of Ayush and Women and Female Child Welfare.
उनके प्रेजेंटेशन तो दूसरी ऑप्शन पहले चीफ गेस्ट फिर लॉन्ड्री को फिर विचार.
Now I request our President, Dr. Sarad Agrawal, sir. Now I request Dr. Sarad Agrawal to give a bouquet to our today's chief guest, Dr. Mahendra Bhujpura, sir, with shawl and memento. Now I welcome Dr. Subhash Sarkar. We are starting this program. Please join with us. Now I request Dr. Sahajan Pratap Singh to felicitate WHO country chief, Dr. Rodrigo Afrin, with bouquet, shawl and memento. Now we request Dr. Vinay Agrawal to felicitate Chairman of National Board of Examination, Dr. Abhijat Seth, with shawl and memento. Bouquet. Now I request our Joint Secretary, Dr. Prakash Lal Chindani, for एक second. Okay. I will give caller to our worthy President, Dr. Sarad Agrawal. All are requested to stand for IMA prayer.
Thank you, Nayak sir. You don't have to repeat after me. You don't have to. Just stand up for the prayer. May everybody be happy. May everybody be healthy. May everybody be free from the pain. May everybody be free from the sorrow. May we be the healing cure beyond every greed and lure. Thank you.
Good afternoon. As you know, today is the 75th World Health Day, and theme of this is Health for All. Our Indian Medical Association headquarters decided to celebrate this 75th year of WHO as a Health for All, and we have given circular to all the 700 branches in 33 states and Union territories to celebrate this World Health Day by the theme of Health for All. And as you know, in morning, everybody in the country have organized walkathon, cyclothon, and Prabhat Feri, and pray for health for all of the people of the India. Second thing, we are also given the circular that all the branches organize such type of seminar and felicitate our nursing staff, our nursing brother and sisters, our paramedical staff and hospital staff, those who have worked hard during 3 years of corona epidemic. So we are also planning to felicitate 12 nurses from all over the India, one from each state. They have worked hard, and our Indian Nursing Council President, Secretary and Joint Secretary have given the name. They have selected those who have not even taken any medal from any organization and work hard. So we have decided to felicitate 12 nurses. As you know, we doctors always believe that we don't ask for anything else. And in Sanskrit, it is written that na tvaham kame rajyam, na swargam, na punarbhavam. Kame dukh taptanam, prani nayarti nasanam. मतलब कि मैं राज्य की कामना नहीं करता, मुझे स्वर्ग और मोक्ष भी नहीं चाहिए, दुख से पीड़ित प्राणियों के दुख दूर करने में सहायक हो सकूं, यही मेरी कामना है। यही कामना के साथ हम सभी आईएमए के डॉक्टर्स काम करते हैं। आज ये प्रसंग में आप सभी गेस्ट पधारे, आप लोग भी हमारे इनविटेशन को स्वीकार करके पधारे, इसलिए सबका आभार व्यक्त करता हूं। नाउ आई रिक्वेस्ट our President Dr. Sarath Kumar Agarwal to say few words regarding this occasion. Thank you.
Thank you, sir. Respected Chief Guest, Dr. Manchpuria ji, Honorable Minister of State for Women and Child Development and Ayush, and himself is a internal medicine specialist. He's a MBBS MD in internal medicine, and he did practice for so many years. And the best part is, in spite of being an internal medicine and practicing in a small place, his fees was till the time he elected for Member of Parliament 10 rupees. So that is the inspiration for everyone. At the same time, the respected WHO head, Dr. Rodrigo, and he is very supportive and cooperative. Since last month, when we conceptualized to celebrating the WHO Day, and he was going out for leave, but he gave me the confirmation on my WhatsApp that he will be joining this function after coming back to India. So thank you, Dr. Rodrigo. My elder brother, our HSG, Dr. Nayak sir, IPP, Dr. Sajanat Prasad Singh sir, Dr. Abhijit Shah, the chairman of National Board of Education, Dr. Vinay Agarwal sir, chairman Action Committee and past national president of IMA, and very dynamic, young leader of IMA, and our finance secretary, Dr. Kshitiz Bali. Respected guests sitting in the audience and all the vibrant nurses whom we have selected for felicitating on this auspicious day, and Dr. Vijay Agarwal, T. Dilip, Mr. Girdhar Gyani ji, Mona madam, and everyone. See, WHO Day we used to celebrate for so many years, and we have organized a walkathon in the morning. It itself shows the dedication and commitment of the Indian Medical Association and our 4 lakh members to work for the society. We have marched on the road just for the awareness of the society. more than 1,000 doctors and nurses. They have collected in the morning at Maulana Azad Medical College, and we walked through up to the IMA office, just saying health for all. We are again reverberating our commitment toward the society for working for the society. That is the message we wanted to give very loud. And we are proudly doing this without any greed or any expectation of anything getting in return. Because as we all know, it is not compulsion on us to do all these charity services, all these services, but we are doing because we love, we want to do this, because we realize our responsibility. We realize that we have to do something for the society, because we don't think ourselves as a businessman, because we are in a noble profession where we think if we do the service, the money is a part and parcel. Though we have been put in as under CPA, and the patient was turned to be the consumer, which we never think, because doctor-patient relationship is a very pious relationship, and all the treatment happen on the trust. So we all know this thing. But anyways, again, I want to say to our chief guest and WHO head that we are committed. The 4 lakh member of Indian Medical Association are committed for the social service, for the service for the people. And our Aao Gaon Chale project is again, re-stamping all these things, what we are saying. We are running this Aao Gaon Chale project for decades and servicing in the villages, for the people lives in the villages. As we all know that WHO mainly emphasize on the preventive part of the health. And IMA, by doing these projects in Aao Gaon Chale, we are mainly working on the preventive part of the health in the villages, making them awareness about what to do's and don't. Yes, of course, because of the COVID, we were more focused to managing it, and this Aao Gaon Chale project was on the back seat for 2-3 years. Again, this year, we have again re-emphasized on this Aao Gaon Chale project, because, sir, this project is being conceptualized by our leader, our visionary leader, Dr. Ketan Desai, sir. He started this project, and he is closely advising us and monitoring it. So what is we are doing under this? We are asking all the branches, the 1750 branches across all country, to adopt at least minimum 1 village in their judiciary area. Minimum 1 village, they can have many villages. And to start doing regular work, regular community services in those villages on regular basis. Like they can do the vaccination, they can do the examination, whatever thing, the camp also. That is what we are doing in the under Aao Gaon Chale project. So we are doing those social service in this during Aao Gaon Chale practice. Until now, we have adopted more than 700 villages. And we are planning to have a big program on a 1 day across all country, in all the branches, that all the members will go to the village and launch it, relaunch it. That is our vision this year. I just wanted to emphasize on 2 issues. At one side, when we are committed for the society, working for the society, we only expect a minimum respect. We are not saying that we are God, but we want some safety. We have never asked anything for us, but there are 2-3 issues which we expect the policy maker should also understand. At one side, when say we are doing all this charity, though we are not forced to do it, but we are doing because we wanted to serve. We wanted to help our government, our policy maker, but at the same time, we expect our safety also. Violence is a huge issue, and I think hardly there is any country where the violence is acceptable on the doctors and the healthcare worker. My request is through our learned and very special very active chief guest and the other dignitaries, at least do something to stop violence. Hospital should be declared a safe zone. There should not be any violence, any kind of violence should be acceptable. And there should be a central law wherein the punishment should be under the IPC. When we have these stringent law, then only we can put some brake on this violence. I am not saying that by putting this, the violence will be zero, but definitely it will be a next step to control the violence from the our government. Other very important issue is the integrated medicine. We all know probably there is a lot of confusion of understanding this issue, both sides. Probably the officers in the government, where they have brought or copied this concept, they have not understood well this, what is this meaning of integrated medicine, and they have not conveyed properly. Because it is a very pious idea and very good concept. But at the service delivery level, it will be a disastrous if we do it at a undergraduate level. IMA is not against any pathy. Rather, we respect all the pathies, be it a Ayurveda or homeopath, Unani, Siddha, whatever. We respect them. We won't let them grow in their field. We won't let them, open the institute, let them do some researches to advance their pathy. We are not against that. We are against the cross-pathy. IMA has a stand against cross-pathy. Holistic approach, we all know, as so many people say, and so many hospitals is still running all these concepts, that there is a allopathy also, there is a homeopathy, Ayurvedic departments also. Let the people decide. Health is by choice. The treatment is by choice. You cannot force any treatment to anyone. So let the people decide what kind of pathy, what treatment they want. But under one roof, all the pathies can be provided. It's a good concept. And where we don't have one specialty, that we can combine the pathy. But we should not have a cross pathy. So IMA stand is that we want, there should not be any mixing or any change at the undergraduate level. Because this system, the existing system of education, brought lot of laurel to the country. We are the preferred country for the medical tourism. We are the preferred country for getting treatment. And many people from the Southeast Asia, they are coming for the treatment in India. Why? Because our outcome is better than other world. Because we are giving the quality care. Because our nursing are the best in other countries, in compared to other countries. Our doctors are world class. So that is why they are coming. And top of that, our cost is, if you compare our cost of treatment with other countries, it is 10 times lesser than what they are providing. So if we get that laurel by this education, then why we want to change this education? So with these words, I again welcome and everyone on this occasion, and thanks to our Minister sir for accepting our invitation. Long live IMA. Jai Hind, Jai Bharat.
Thank you, our President, for their nice narration. Now I request Dr. Subhash Sarkar. He is a Minister of State for Education, Member of Parliament from West Bengal, from Bharatiya Janata Party. He is a working gynecologist in West Bengal. He is in the tour, but he has a very good affection with the doctors and nursing staff. So he, on our request, he joined us. I request Dr. Subhash Sarkar say a few words on this WHO Day, Health for All. Please, sir.
Warm regards to all. Namaskar.
Namaskar.
Khurum Jari, this is from Manipur. Sat Sri Akal, this is from Punjab. Khamma Ghani is from Rajasthan. Vanakkam from Tamil Nadu, and Namaskaram from Malayalam, from Kerala. Let's say, today, all the galaxy of stars have joined in this program, especially Dr. Anil Naikji, and also the chief guest, Dr. Mahendra Munjepana, who is the Union Minister of State, and also my beloved friend also. I will ask everyone to give a clarion clap when I will tell the names. For Dr. Anil Naik also, and the country chief, Dr. Adik, Dr. Vinay Agarwal, Dr. Sharad Kumar Agarwal, President, just now he has delivered his speech. Dr. Sajanand Prasad Singh, Dr. Shatish Bali, your Finance Secretary, please, and all other distinguished personalities from IMA. Really, this year, the World Health Day theme is Health for All, and which our country thinks 1,000 years. And this government vision is also the same. Under the visionary leadership of our Honorable Prime Minister, Sri Narendra Modi, a proactive approach has been adopted by the government, and a paradigm shift took place in the healthcare sector. A new approach to health and wellness become to the core of health sector governance rather than just treating the sick persons, not only to treat the diseases. Honorable Prime Minister Sri Narendra Modi ji said, we have adopted a holistic approach in our healthcare system. Today, our focus is not only on health, but equally on wellness. The Ministry of Health and Family Welfare, through various centrally sponsored schemes and central sector schemes, supplements the efforts of the states and also the UT in the healthcare sector. The government is ensuring holistic healthcare through some of the major schemes, which we should know, all the IMA members. And through this, we can convey this message to all doctors and also the whole society, because society should take the benefit of all those schemes. And that is National Health Mission, Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, Pradhan Mantri Ayushman Bharat, this is very important, Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, PMABHIM, and also establishment of new medical colleges, National Program of Prevention and Control of Cancer, Diabetes, CVDs, and strokes, National Vector-Borne Disease Control Program, Pradhan Mantri Swasthya Suraksha Yojana, PMSSY 3, under which so many new aims as well as upgradation of existing medical colleges have been done. And all the states have to do it in a proper way. There are some medical colleges, already fund have been given more than 6 years back. Instruments have come, but they have not opened the instrument. Installation have not yet been done. I will request all the members to pursue so that instruments should be installed. Otherwise, they are already the warranty period that is will be lost. Ayushman Bharat Yojana stands on the 4 pillars, which are Ayushman Bharat Health and Wellness, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat Digital Mission, and Ayushman Bharat Health Infrastructure Mission. Yes, in 2012-2013, AIMS started their academic sessions. But 2014 onwards, by following the vision of our now Honorable Prime Minister Sri Narendra Modi ji, under PMSSY, 16 major projects for new aims in various states of the country. That is Uttar Pradesh, Maharashtra, Andhra Pradesh, West Bengal, Punjab, Himachal Pradesh, Assam, Jharkhand, Gujarat, Telangana, Jammu and Kashmir, Bihar, Haryana, and Tamil Nadu are running. Our government has provided vaccination to all, including under the Vaccination Maitri program. India has supplied COVID-19 related medical and other assistance to over 150 countries since the beginning of the COVID-19 pandemic at a very affordable price. Mission Indradhanush has immensely contributed to filling the gaps and making lasting gains towards universal immunization. The Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is the world's largest health assurance scheme. The government is also taking care of the citizens' mental health. This is also very, very important. The Manodarpan has been started to provide psychological support to students, teachers, and families for mental health and emotional well-being were taken during COVID pandemic. Under the guidance of our Honorable Prime Minister Narendra Modi ji, the International Day of Yoga has been celebrated across the world annually on June 21st since 2015. Following the inception of the United Nations General Assembly in 2014, the worldwide acceptance of yoga is a matter of pride for our country, as yoga is an integral part of our nation's cultural and spiritual heritage. In this way, the Honorable Prime Minister Sri Narendra Modi-led government has made Indian healthcare future ready. We can tell, Vyamat labhate shastam dirghayusnu valam shukha aragya paramang bhagyam shastam sharbartha sadhanam. It means health is the biggest wealth in one's life. It is the only thing with which all the other things can be achieved of life. With exercise, one can achieve perfect health, happiness, longevity, and strength. I would like to add few more words. Today's theme is health for all. And you have also given a quotation that is a Samarpan Divas. And today we hope all the doctors, ये दोनों को समझ के, this is a समर्पण दिवस, हम लोग समर्पण करेंगे समाज के लिए, ये है, लेकिन इसके लिए for that we can develop few more things. It is my request, and we can send the message to everyone. We can develop our communication skill little bit better way. This is definitely, I understand. In some government hospitals, the workload is maximum, but we have to find it. That how can I satisfy with a minimum time? Yes, I saw one person, he was a ENT surgeon, and I have seen that he used to observe the maximum day in the OPD. Even whenever his OPD is also not, but he sometimes comes to manage that. In one day, he attended in about 4 hours, about 100 patients. But how fantastically he managed. And we can find our different practices in a different art form. His art was, he always asked the people with तू करके बताते हैं सबको, उनके बड़े उम्र को भी इतने अच्छे से। लेकिन कुछ ऐसे आदमी होता है जिसको बहुत ही सोफिस्टिकेटेड है, उसको आप करके कहते हैं, लेकिन बड़े उम्र को भी तू करके बता के उसको अपना बना लेते हैं। एंड but he has not left any point to observe. Turanti, though he was an ENT surgeon, but he don't forget to look after the palpebral conjunctiva. This kind of. Similarly, I saw one internal medicine specialist, very fast, but his communication skill is very much well. We should think that we have to communicate in such a way our mind should reach at their intellectual level. And at the same time, in our country, healthcare system is very well. If everybody does sincere work, then health can be reached to home. I hope our government is doing this healthcare system in a proper way. That is a wellness. Everybody should remain well, not only to treat the disease. I hope Indian Medical Association will say all the members, and today, for this reason, Samarpan Divas have been called from Indian Medical Association. I am very happy to know this, and we will send the message to all members to reach to the people through our ecosystem, through our nurses and all paramedical staffs. And we will always think it is a teamwork. Whenever anything bad is being done, bad has been happened, for that, we whole team is responsible. If we take in this way, whenever anything good have happened, very good result, then it is the team's satisfaction. It is the team's result, team's perfection. Thank you all. Bharat Mata ki jai.
Thank you, Dr. Subhash Sarkarji, for your valuable suggestion and good words for our medical fraternity and nursing fraternity. Now, I request our guest of honor, Dr. Rodrigo Ofrin, to say a few words on this occasion.
Dr. Sharad Agarwal, President, IMA. Dr. Manjpura Bahendra, their chief guest, Minister of State, Ayush, and WCD. Dr. Subhash Sarkar, who we just heard speak. Namaskar. Dignitaries on the dais, off the dais, online, everyone, friends, thank you for inviting me today. It is the Diamond Jubilee of WHO. It's a very special occasion. And to be able to celebrate it with you, the IMA, thank you for bringing us together. So today we turn 75. The day marks the coming together of countries across the world to establish WHO. In 1948, that was the year countries came together. It was just after the war, to promote health, serve the vulnerable, and respond to public health challenges as one, so that everyone, everywhere could attain the highest level of health and well-being. That's enshrined still in our Constitution. And that's what makes WHO unique, is that it is a member state organization. We work with countries. It's not we have our own programs. So that was the idea. And ever since, April 7 has been observed as World Health Day, our birthday. Now, the connection with India is actually very special. India became party to the WHO Constitution on January 12, 1948, one of the first countries that have signed. It hosts the WHO Regional Office for Southeast Asia, which covers 11 countries: Bangladesh, Bhutan, India, Indonesia, Maldives, Myanmar, Nepal, Sri Lanka, Thailand, and Timor-Leste. and North Korea. So there were politics also involved at that time. And of course, that was held on October 4, 1948, the very first regional committee. And in fact, in 1962, the first World Health Assembly outside of Geneva was held here in that building in ITO that's being refurbished. So the WHO Country Office for India was also born at that time. It was together. And I will tell you that our first office was Patiala House, the courthouse. That was the very first office of WHO. Of course, our program supports the country, national and state governments, to innovate, accelerate, and sustain actions on public health practices. And today, 75 years later, the WHO Country Office for India is 2,600 personnel strong in 271 locations all over India, partnering with all of you and with state governments to deliver health. Now, India has built on its many public health successes. Dr. Subhash has mentioned many of those, including elimination of smallpox, polio, maternal and neonatal tetanus, and yaws, by rolling out diverse programs to strengthen the quality and reach of public health services. It's mainly, if I'm sure you are all our partners in immunization in DOTS through your programs. Under the government's flagship program, the Ayushman Bharat, 150,000, 1.5 lakh health and wellness centers are already up and running since its inception in 2018 to provide comprehensive primary health care across the country, while the Pradhan Mantri Jan Arogya Yojana provides insurance assurance for over 500 million beneficiaries. That's the biggest health insurance in the world. I think it's this, the scale and reach. It's everyone in the world wants to come to India to learn from this. My inbox is full of may I come, may we come, because we want to learn. The reach and quality of services is being further expanded through Ayushman Bharat digital mission, under which around 25 crore health records, that's again, let's put it, you all understand crore, but it's 250 million health records of individuals have been linked to their Ayushman Bharat health accounts or the Abha card. I'm sure many of you will have that, to ensure continuity in access to health services at all levels everywhere. So it's also setting up a system for the future. By being digital, you reach more. The Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, as mentioned, or the PM Abhim, is a massive goal of a district hospital in every district and a BSL-3 lab in every district, with an epidemiologist in every district, which aims to focus building resilient health systems to effectively respond to public health emergencies, that which we all know very well the past 3 years. The One Health approach, or all sector approach for multi-sectoral action, has been adopted in mission mode for disease prevention and promotion through the rollout of the Jal Jeevan mission. We have safe water. If there is safe water, there will be health in every household. Swachh Bharat to promote sanitation, and Ujjwala Yojana to provide clean cooking fuel to rural families is another initiative. So health is not just with the health sector or with the medical sector or with nurses or with allied medical professions. Many a time we actually receive sick people because other sectors have really not done so well, if I may be diplomatic about it. India has also prioritized the elimination of tuberculosis, neglected tropical diseases such as lymphatic filariasis, leprosy, and Kala-Azar, achieving over 90% full immunization coverage nationwide, and providing treatment for the screening management of non-communicable diseases such as diabetes and hypertension through a very rapid, scaled-up program with the India Hypertension Control Initiative, which will now be integrated with the comprehensive primary healthcare services in health and wellness centers. Moreover, WHO has also recognized the long wisdom of Ayurveda. And we have, together with the government, set up a global center for traditional medicine in Jamnagar in Gujarat to do research, to get evidence of this wisdom for health. In this comprehensive and coordinated pandemic response, of which I was a witness firsthand as I moved into this job July 2020, as they said, from the frying pan to the fire. That is my specialty, public health emergency management, disaster management. So it came to me a huge, it's just something impressive that no country has ever done. The rapid expansion of testing, tracking, and treatment capacities from 3 labs to 3,000 in a few months. That's how huge the jump was. Scaling up its lab infrastructure, development of a made in India vaccine, and rolling out the world's largest COVID-19 vaccination program with over 2 billion doses delivered. India has demonstrated its capacity for planned and coordinated action to achieve public health goals at a scale that no other country or region of the world has. Now, why am I saying that? Is that in all of this, the Indian Medical Association, the medical community, the health workers and the health workforce in coordination with other sectors have been central to this journey of 75 years for the health of India, and consequently, I would say the health of the world. A healthy India is a healthy world. If we eliminate an NTB, the world will end TB. If we have hypertensives treated at the scale that we have, the world's numbers of hypertensives will also decrease. And more, I look forward to the partnership with the IMA for your initiatives for preventive health. Thank you for your work and your dedication, putting your own health and safety on the line for a larger cause. And much I know, as well as in my own organization, putting that dedication has also the most precious thing. They have put their lives on the line. My deepest gratitude. Now to the future, what is the next 75 years? To our future successors, our future selves. The India G20 presidency is an opportunity to accelerate action to build health system resilience to prevent, diagnose, manage, and treat existing and emerging diseases, and mitigate the health and socioeconomic impacts of emergencies for equitable and sustainable development. I think that's the investment where this will all need to go. There will be investments in every district. Let's look at that and how well it will serve people. At the end of the day, it is about the health of people. That's why the theme for today is health for all. And maybe it's not just for today, it's for every day. Health for all by all. And I truly feel that India, with your participation as a very strong organization, can lead the world in building back resilient health systems to prepare for pandemics and disasters and achieve health for all. Thank you very much for your time. Thank you. Thank you.
Thank you, WHO country head, Dr. Rodrigo, for their kind words. Sir, we have worked with the government in last 5 years for the end TB in RNTCP and DOT program, and we have sensitized our doctors all over the India. As you know, 75% of the people are taking treatment in private sectors. So we have sensitized all the doctors to send their tuberculosis patient for the record to the government. And for that, our mission to end TB in 2030, But our Prime Minister, Mr. Narendra Modi ji, wished to this in 2025. So we all have to work hard. We have to work with hand to hand. That is our request. Now I request our friend and chairman of the National Board of Examination, Dr. Abhijat said, to say a few words for this occasion. Thank you.
Respected Dr. Mahendra Mujapra ji, Dr. Sharad Agrawal ji, Dr. Rodrigo Hoffman, all my colleagues on the dais, all respected senior faculties. Namaste and very good afternoon to all of you. I'll be very brief. On behalf of the National Board of Examination of Medical Sciences and BMS family, I extend our gratitude as well as congratulations and compliments to both WHO and National IMA for celebrating the World Health Day. Interestingly, all has been said. The organization stood by all the health crises globally, WHO, and at the same time, we also know that our national IMA always stood by all the health crises across the country as and when required, and is one of the strong and the largest organization in the world with the members of almost 400,000 professionals. We all know that healthy young or healthy individual has very strong fortitude to confront the health problems, whether it comes to the national level, whether it comes to the local level, or whether it comes to the global level. So first, being healthy yourself is the essence of the building of the culture, and then you can pass this culture to others and make sure that you make the others healthy too at the same time. IMA is very important. Although I'm not as active member as you people in IMA, but I love IMA from my college time. And I have seen their human touch to all the stakeholders and professionals, irrespective of whether it is a national level or whether it is a state level. And I must compliment them for that. They have been to all sorts of health crises. As in Delhi, I know only few people because I met them quite frequently. Some of them are here, but I remember Dr. late K.K. Agrawal Saab, and I remember till his last breath, he continued to serve the medical fraternity, and he gave all sorts of moral boost during the COVID time. And we lost more than 1,000 IMA members in the COVID time, and we must pay tribute, and we must accept their services to the humanity. And this is what the contribution of IMA. I remember my few colleagues are here from Gujarat. For example, Anil Nayak, I know him well because he's a batchmate, of course, not in my hospital. In earthquake, he left his practice and he was on the ground in the Kutch for 2 months continuously. Like Dr. Mujapra ji, he's our college mate. I've never met him before. This is the first time I met him face to face. I must have met him during the college time, but I think forgot, we lost in our professional practice. But till now, he's the same guy with the empathy to his patients, irrespective of whether he is level of politician or anything. He is the same to his patients all the time. And this is, I'm not heard from him, I'm heard from his patients. So that is very, very important to us. Now coming to the point of the contribution from IMA to the WHO cause, it's very important that WHO is a global organization while National IMA is a national organization. And certainly you won't have any better stakeholders to work in India for the theme of health for all. As Dr. Rodrigo's team has already elaborated the health for all theme, I read a couple of things like role model, to build up the culture of health in the community. So it percolates the healthy culture into the community, and then it becomes more easy to spread and percolate the healthy culture to the farthest part of the nation. In the similar line, I also add one more point, which I have seen during my experience, is which the national IMA can always adopt, is a primordial health concept, which is not introduced in this country. The primordial health concept is the concept where the health education or awareness or that happens at the time when the health risk begins in the formative years of children. So what happens that the parents, the peer group like us, IMA, the teachers, all there built up the culture of health in the school. It's not very costly affair. It just requires an effort. IMA has got such a huge network across the country, including the state IMA, and WHO and IMA can jointly initiate this kind of concept in the country to fulfill their dream of health for all. Lastly, looking at the proactive approach, I remember this is my 7th year in National Board of Examination. The way government monitor us for our performance is phenomenally very strict, and we have to answer them from time to time about what we are doing. With such a proactive support from the government, including the Honorable Prime Minister Narendra Modi ji, including the Union Health Minister Mandavia ji, including Dr. Mujapra ji in the Ayush, we together with the WHO, we must commemorate this World Health Organization Day with pledges, passion, and positivity to reach to the health for all as farthest and as best as possible we can. Long live IMA. Thank you so much.
Thank you, Dr. Abhijat Seth, for your kind words for IMA, WHO, and all the medical fraternity. As you know, IMA had given the call, 7th April, 7 p.m., light a lamp for health of the all. As a symbolic of this, I request all the dignitaries, the chief guest and everybody to light a lamp and pray for health for all. शुभम करोति कल्याणम आरोग्य धन संपदा शत्रु बुद्धि विनाशाय दीप ज्योति नमोस्तुते. दीप ज्योति पर ब्रह्म दीप ज्योति जनार्दना दीपो हर तू मे पापम दीप ज्योति जमोस्ते. Thank you. Sir, today chief guest, Dr. Mahendra Punjpura. He did his MBBS and MD from Ahmedabad, NHL and BJ Medical College, Matrasni. He had worked hard in cancer hospital, in Nariyad Kidney Hospital. Then he went to Surendranagar, which is a district place in Saurashtra, where he served in Sitaram Trust for 10 years. And at that time, being a consultant, doing a post, his consulting fee was just 2 rupees with medicine and everything. 2 rupees he was taking for 10 years. Then he started his own clinic, and in his own clinic, he charged 10 rupees only. When he get ticket of member of parliament to contest the election, he had his own car also. Till today, he has no own car. He's riding only motorcycle and scooter only. So he's so simple, so nice man. Government is providing me jet security, but he's not taking any security with him because I am a doctor. I have no fear from anybody. So that is so simple, sir. And he himself is 108 for me. Any time I call, sir, you want to become the chief guest, you have to come to IMA. He never denied me. Okay, Anil bhai, आप बोलते हो तो मैं आ जाऊंगा. So sir is always for me. He is a member of IMA from Surendranagar. So I request our chief guest, Dr. Mahendra Punjpura sir, to say a few words. Thank you, sir. Please welcome.
National President, Dr. Rodrigo H. Offrin, Country Head, WHO. My fast friend, Dr. Anil Nayak ji, Dr. SNP Singh, Dr. Abhijat Seth, Chairman, National Board Examination, Dr. Sitish Bali, Dr. Vinay Agrawal, Chairman, Action Committee, and all my colleagues. वैसे तो अनिल भाई ने काफी बता दिया है, लेकिन मुझे यहाँ आके बैठना होगा एज ए प्रेसिडेंट, नहीं तो मैं आ भी नहीं पाता. थोड़ा बैकग्राउंड बता दूं तो MBBS MD करने के बाद मैं नडियाद किडनी हॉस्पिटल में प्री DNB स्टूडेंट, क्योंकि DNB में एडमिशन लेने से पहले 1 साल निकालना पड़ता है, तो मैं ज्वाइन हुआ था. उसी वक्त एक यूनिवर्सिटी ऑफ अरकानसास यूएसए की यूनिवर्सिटी में मैं सिलेक्ट हो गया था. लेकिन सब अनिल भाई जैसे अच्छे दोस्त ने मुझे बोला कि एक बार तू यूएसए चला जाएगा तो बाद में वापस नहीं आ पाएगा, और वैसे भी मैं भी अनमेरिड था उस वक्त. तो देश की सेवा के लिए सिर्फ 2 रुपीस में काम चालू किया, और आज मोदी जी ने यहां बिठा दिया. और वैसे ही पीजी में एडमिशन लेने के भी एक रोचक स्टोरी है. बेसिकली मैं MD इंटरनल मेडिसिन में मैंने किया है, लेकिन मेरा इंटरेस्ट पीडियाट्रिक में था. लेकिन आप सबको मालूम है कि एक एक मार्क्स के लिए 20-25 स्टूडेंट होते हैं सेम मार्क्स में, तो पीडियाट्रिक मुझे नहीं मिला। बाद में मेरे सब दोस्त ने बोला कि पीडियाट्रिक नहीं मिला ना तो गायनेक ले ले, उसमें कमाई अच्छी है। क्योंकि 24-5 इयर्स एज यही होती है ना कि किसमें कमाई, क्योंकि पहले क्या होता, पेरेंट्स घर से जो पैसे भेजते मनी ऑर्डर से, उस वक्त तो मनी ऑर्डर था, उसमें से हमारे को पूरा मंथ चलाना होता, तो रेस्ट्रिक्शन में पैसे से चलाना पड़ता, इसलिए कि गायनेक ले लो। गायनेक में भी मुझे नहीं मिला। लेकिन 30 साल बाद भगवान ने मेरी प्रार्थना सुनी और मोदी जी ने मुझे महिला और बच्चे, वुमेन एंड चाइल्ड डेवलपमेंट दोनों एक साथ दे दिया। Physically, our Indian Medical Association is about more than 100 years old organization with 1,700 branches and 4 lakh life member of modern medicine, serving citizen across length and breadth of country. It is pertinent to mention that IMA has taken up various public-centric health projects like pulse polio and COVID care, tuberculosis prevention, antimicrobial resistance, ethical medical practices, geriatric medicine, organ donation, etc. Honorable Prime Minister Shri Narendra Modi ji has always focused on ensuring that health service reach the last mile, and that too at an affordable rate. Keeping in view this broader mission, presently the IMA leadership at branch, state and national level is engaged in ambitious project of improving healthcare at village level by project Aao Gaon Chale. All branches will adopt one village and take care of its inhabitants' medical health. Above than 1,100 villages have already been adopted. WHO is celebrating 75 years of its inception, and theme for this year is Health for All. National IMA celebrating WHO Day by organizing day-long activities like walkathon in morning and seminar in afternoon in association with WHO. I am told that more than 1,000 doctors participated in walkathon starting from Maulana Azad Medical College and culminate at IMA headquarter building. Various eminent speakers are deliberating on important healthcare issue during seminar at India Habitat Center. Country head of WHO shall give keynote oration today. I look forward to outcome of this seminar. The highlight of program will felicitation of 12 nursing officers chosen by India Nursing Council. This time, the organization has decided to award nurses rather than the doctors and recognize the good work that they are doing. In the evening at 7 p.m., all the 4 lakhs members of IMA shall light lamp for health of nation. Heartiest congratulations to the National President, Secretary General, and all office bearers of IMA for great function on World Health Day. In the end, we must all remember that in India's G20 presidency, we have to work towards goal of one earth, one family, one future. Under the able leadership of Honorable Prime Minister Shri Narendra Bhai Modi ji, India has demonstrated to world once again what that collective efforts can achieve. This is most visible in the field of COVID vaccination, where in all
team health worked hard to ensure that entire population get vaccinated. And two things that is mentioned by our President Sharad Agrawalji, hospital violence and integrated medicine. And we are all facing from some cases of hospital violence due to misunderstanding of the patient relatives. And about integrated medicine, it is not cross-pathy, not mixopathy, because I am Ayush minister. It is co-location, means in under one roof, one surgeon, one physician, one gynecologist can sit. That type co-location, one allopathy doctor, one Ayurvedic, one homeopathy, one Unani, one Siddha sit. There is nothing like cross medicine prescription that like. And हमारी जो सब एम्स में हमने इंटीग्रेटेड मेडिसिन की ओपीडी चालू की है और सब जगह एक बिल्कुल सही तरह से चल रही है और काफी अभी हम आगे भी बढ़ रहे हैं, लेकिन ऐसे अपने जो एलोपैथी डॉक्टर्स का फ्यूचर को कुछ भी डिस्टर्ब होने वाला नहीं। हम सब साथ मिलके एक होलिस्टिक अप्रोच से हम एक हेल्थ प्रोवाइड करने जा रहे हैं। थैंक यू। जय हिंद, भारत माता की जय।
Thank you, Dr. Mahendra Mujra, sir, for your kind words. Now it is time to felicitate our nurses. I request Dr. Mujpura sir, Dr. Sharad Agrawal sir, Dr. Rodriguez to come on the stage, and Dr. T. Dilip Kumar, President of Indian Nursing Council, to come in front of the stage. I request all the nurses name by name. Once I speak your name, please come and receive your address. First is Mrs. Lily Florence Kolasunaki. As you know, during COVID time, more than 2,000 allopathic doctors have given their life, and more than 3,000 nurses has also given their life to serve the people of the nation. Now, Mrs. Lima PG. Mrs. Lima PG. Now, Dr. Iqbal A. Kadiwala. He is a brother working in Government Medical College, Surat, one of the hospital. Kadiwala is also member of the Indian Nursing Council and Vice President of Gujarat Nursing Council. Now, Miss Sapna Sharma. Now, Miss Saroja Jaykumar. Their biodata is on display on the screen. Miss Saroja Jaykumar. Mrs. Sina AM. Mrs. Sina AM. She is from Kerala. Diploma in General Nursing. Miss Sefali Malik. Miss Sefali Malik. She is from New Delhi. Miss Meenakshi Vyas. Miss Meenakshi Vyas from Jaipur, Rajasthan. Miss Kurusungam Pushpa. Miss Kurusungam Pushpa from Telangana. Miss Punita Yadav. Miss Punita Yadav. He is from Uttar Pradesh. Colonel Binu Sharma. Colonel Binu Sharma. She is from Delhi. Senior Director of Nursing at Max Healthcare. The Major Sonia Kapoor. Major Sonia Kapoor. Thank you, sir. Thank you all nurses and all the members. Please come to the dais. Now I request our Finance Secretary, Dr. Sitish Bali, to say a word of thanks. Dr. Sitish Bali.
Thank you so much, sir. I would like to thank our National President, Dr. Sharad Kumar Agarwal, our HSG, Dr. Anil Kumar Nayak. Special thanks to our chief guest, Dr. Mahendra Bhai. And special thanks to the country head of WHO, Dr. Roderick also. And special thanks to the minister who joined us from online, Dr. Subhash. The list is quite long, so I'll just read it through. So I would like to thank Dr. SNP Singh, our immediate past president, Dr. Asokan sir, our president-elect, Dr. Vinay Agarwal, past national president, chairman of the Action Committee, which is responsible for hosting this particular function, Dr. Prakash Lanchandani, our joint secretary, Dr. Venkatachalapati from Bangalore, our joint secretary, Dr. Anand Prakash, our assistant secretary, Dr. Padmanabhan Thakur, assistant secretary. Would like to thank Dr. V.K. Munga, past finance secretary, Dr. Rai, our past HSG, Dr. Ramesh Gupta, past Finance Secretary, Dr. R.N. Tandon, our past HSG of National IMA. Would like to thank the staff of IMA who has done a commendable work since morning. Dograji, Bimal, Ramesh Arya, Rakhi, Gautam, Sachin, Yogesh, Manoj, Pradeep Pandey, Sumit, Bakshi, Gaurav, Argo, and Paul. And a special thanks and a special round of applause for all the awardees here. Can we have a round of applause for them? Thank you, sir.
Dear friends, our session 1 for panel discussion we will continue. This program is the first inauguration is now complete. So I request all the dignitaries to come down, and I request Dr. Vinay Agrawal, the coordinator for this session 1 on panel discussion or health for all. Being a moderator, you can handle this. Thank you.
I request everyone to please stay back. Dear friends, a very important academic sessions are there, and a very, very important session of the day, and that is the Health for All seminar. And we have none else than Dr. Vijay Agarwal, my elder brother, President of KAHO, a person who is known for his business, a person who is known for his sincerity, a person who started Delhi Nursing Home Forum, was involved with the Quality Council of India, is now President of KAHO. I mean, the series and introduction goes on. I am privileged to be his younger brother for almost now 55 years. And I'll request Dr. Vijay Agarwal to please come and introduce his speakers. I'll request Dr. Sharad Agarwal also to stay back. My request to all of you, please, even the awardees, please stay back. They are very, very important sessions, and you will appreciate those sessions. All our awardees, and I'll request our WHO consultant also, country head, please sit back. We'll love to have you here because this is session for Health for All. Okay, right. Thank you. Dr. Vijay Agarwal, please.
Good afternoon, friends. I'm first of all indebted to Indian Medical Association, all your leaders, especially to Dr. Vinay Agarwal for asking me to be here, a part of this very important session on Health for All. When I was listening to the IMA prayer, I think nothing more can encapsulate Health for All. Every word of what is there in your prayer is what can be said for Health for All. The issue that Health for All, is it going to remain a dream? Is it going to remain a mirage? I think it should have been the natural feeling or instinct of everybody that there has to be a Health for All. But probably in 1978, by the formation of the primary health center concept, at least the beginning was made. And at that time, it was envisaged that we should have Health for All by the year 2000. I'm not sure whether we are going to have Health for All even by 3000. Because I think the complexity of achieving this goal is huge. And sometimes I feel as if the health is like an elephant which is being described by blind people. So somebody who is only touching its trunk, somebody its legs, So we don't even know what is it that it means to make health for all. One thing for sure, that health for all cannot be just the delivery of the doctors or the Indian Medical Association or anybody. It's a far more complex things where the people themselves today have to take the ownership of going ahead with that. Today, the healthcare delivery has become extremely complex. It used to be a very simple, inexpensive, and maybe just a physician and a patient relationship. And that has now converted itself into a very complex healthcare delivery. It has become very high-tech, expensive, but then extremely, I would say, extremely efficient and effective. And that's the reason people like us who are even born prior to independence, and we are leading an active life. And that's because of this availability of very high-tech healthcare system that we have. So to discuss this very, very complex topic of health for all, I have a very illustrious panel. So I'll request Dr. Girdhar Gyani to please join me here. Friends, I think Dr. Girdhar Gyani, if anybody here doesn't know, he is the father of quality of healthcare in our country. He was the Secretary General of Quality Council of India at one time. He was also the first CEO of the NABH, and has been the person who started the whole concept of the national accreditation systems. Then we have Dr. Nimish Desai. Dr. Nimish Desai, who is the former director of IBHAS. Who doesn't know him? He's a very charismatic and well-known psychiatrist. Then we have Dr. T. Dilip Kumar, and I'm sure all the nurses of the past, present, and the future will probably know that he has been the president of the Indian Nursing Council. And then we have Dr. Puneet Mishra. Dr. Puneet Mishra is from the prestigious All India Institute of Medical Sciences and has huge interest in the non-communicable diseases. I have tried to kind of divide this entire topic of health for all. First and foremost is the universal health coverage and maybe maternal and child health, which I'll ask Dr. Girdhar Gyani to address. Then I feel that mental health is an extremely important part, and that's what Dr. Nimish Desai will talk about. Non-communicable diseases have now become a huge important part of the health for all, and that will be Dr. Puneet Mishra. And then I think the workforce of the healthcare, and which at the moment is represented by the nursing, and we'll have Dr. Dilip Kumar, who will talk about the challenges that are being faced by the nursing profession. So, Dr. Gyani, sir.
प्रेजेंटेशन दिखाना नहीं ऐसी है क्या? नहीं तो मैं ऐसे ही बोल देता हूँ. योगेश को दे दो ना. है अच्छा. योगेश को दे दो क्या इधर? ये सब देते वो योगेश भाई. या नमस्कार. ये इनकम मैंने तो दे दिया. आपका है? नहीं तो आप आ जाओ पहले तो. नहीं जब तक लोड हो जाएगा. मेंटल हेल्थ पे क्या बोलते हैं?
Anyway, sir, mental health is more important than any other health. So,
good afternoon. I'm going to disappoint my friends on the dais and possibly off the dais. Not talk about mental health too much today. I'm also qualified, interested public health professional, and having been a health manager and stuff, what appeals to me is the theme for today. From what Dr. Vijay Agarwal was saying, let me continue from there, the alma mater. I was just finishing my MBBS, and then we got into the internship, and then after MD Psychiatry, worked at Demands and then came to AIMS. When I came to AIMS, I met people like Dr. Ramalingam Swami and others, who apparently had been at the alma mater meeting. And so I had the opportunity to ask and say, like Dr. Vijay Agarwal was saying so well, I mean, way back then in 79, 80, 81 even, it seemed a very far-fetched goal to set for the world community to say health for all by 2000. And like I written on my Facebook post today, every MD Viva, every question paper had short note or essay on health for all by 2000. And by the 90s, when I had a chance to ask people, something very interesting came up. I don't know if anyone of you knows, including our friend from Community Medicine AIMS. See, there were very few computers at best, those electronic typewriters or, manual typewriters. So what was intended, I am most reliably told, is the slogan was supposed to be health care for all by 2000. Somewhere, either by typo or by somebody's intention, good or not so good, it became health for all. Now that's very crucial. Please pay attention, because even then I felt 40 years ago that it was impossible by 2000, and I completely agree with Dr. Vijay Agarwal, even by 3000. Health for all? Come on, get real. Get your feet on the ground. Okay, that's my Facebook post for this morning. And I have no hesitation in saying so. In fact, I said to the WHO chief when he was leaving, I said, please sit back and listen, because I'm going to pick a hole. Having said that, again, as Dr. Vijay Agarwal was saying, to be aspirational, to be bombastic, to be larger than life in goal setting is good. Goal setting can be aspirational. Policies should be aspirational. Programs can be aspirational. And now I'm going to come to the mental health field for a minute back. Unfortunately, like we recently experienced in our neighboring state, and kudos to all the IMA office bearers for what you have achieved. If you try and get such aspirational ideas into law, you create anarchy. And the Mental Health Care Act 2017, which replaced the 1987 Act, actually has done this. Section 18 of the MHA 2017, fortunately, does not talk about mental health. I mean, that'd be impossible, mental health for all. Even health for all, like we said. Actually, Section 18 only says right to access mental health care. Even that is becoming so difficult. The 2017 Act was implemented in May 2018, and possibly 2 or 3% of what is meant has been done. So my major point, friends, is for this panelists to reflect on and all of you to consider, to repeat myself. Goal setting, aspirational, Ram Raj is fine. Even policies can be aspirational. You might even make programs slightly unrealistic and in the sky. But laws can't be devoid of ground reality. Certainly not across sectors, as you already pointed out so well in our neighboring state. So one caution about this whole health for all slogan is this, very seriously, very strongly. Number two, I seriously have had problems for now at least 25 years, if not 30 years, with this 1974 hallowed sacrosanct definition of health by WHO. Again, I mean, all of you must have realized by now that I don't wear a WHO tie. I've never drawn any of my salaries from WHO. And while I respect WHO and I have occasionally worked with them, I have no problems in recognizing the truth about WHO or UN agencies. Again, possibly in 1974, it was okay to visualize the way it was. And he will know, our friend will know, there was some gentleman, one professor of community medicine who in the 60s defined health on those lines, and then WHO picked it up. I forget the name at this time. Please be with me, walk with me for a minute or two when I share my very strong reservation about that. My reservation is not about the second part. Physical, mental, social, spiritual added, very good. My huge discomfort is with the first part of the definition, the stem. Absence is not only absence of disease. Come on, damn it. If you recognize NCDs and chronic diseases, there are very few people beyond the age of 40 who have absence of disease. So the major principle ought to be learning to live with the disease, impairment or illness, not absence of disease. So really seriously 1974 definition needs a serious review. So the only word in this slogan for today, which may be all right, is the word for. Health seriously requires reconsideration. Whether you can achieve it for all or not, like he said, serious consideration. But honestly, jokes apart, universal health coverage, like you have experienced in mental health. I mean, in a way, I'm glad. In a way, I'm glad that perhaps for the only time or one of the few occasions, psychiatry and mental health are ahead of healthcare. Before you guys brought right to health, we got right to mental health. Okay, except that it remains on paper. Large part of it remains on paper. Unfortunately, so I'll keep going back to the recent fracas in our neighboring state, and I really believe, and this is my last point, sir. I have as an academician, as a medical doctor, member of IMA, always supported IMA and been very happy about it. But I have sometimes had this doubt whether IMA should be a professional body, academic body, or a trade union, or all of it. But certainly last 2 months have convinced me about the role of trade unionism. It was very necessary and it was very timely what was done. Because what was planned for whatever reasons was pathetic. And the point is that when you plan unrealistic policy, program, or especially law, you create more chaos than help people. So like everybody has been saying in the inaugural function and Dr. Vijay Agarwal said, we all want that. If at all, what we should be looking for is not health for all, perhaps health care for all, not even that, perhaps access to health care for all. That's a realistic slogan. Thank you so much.
I think, thank you, Nimish. You brought out some very beautiful points. And in fact, I'm just trying to draw a corollary that if a right to health was to be enacted, then I don't know whether all the people who become, over BMI or their obesity or somebody who is not doing exercise in the morning, should they be put to jail or something like that? Because the right to health cannot be just the right of a nursing home to provide you care when you fall sick. Right to health starts from you, and therefore the government may probably try to get into that you need to remain healthy. So it's a very interesting thought process that you have started, and no doubt about it, that even health care for all, and that's where the whole ecosystem of healthcare is also getting revolutionized, as we will probably learn more. May I request Dr. Girdhar Gyani to talk about universal health coverage. How do you, sir, envisage that piece of the...
Thank you. Okay. So at the outset, मुझे दो बातें कहनी है about the IMA जो recent हुआ है. आज का जो ये कार्यक्रम है, what impressed me a lot, that the leadership of IMA has brought nurses leaders together. Because I think some of you know that when we were working on NABH, so my first priority was to bring nurse as a part of the assessment team right from the day one. So they have been working with our doctors to assess the hospitals along with that is number one. Then, of course, I designed, empowerment of nurses and nursing excellence standard also before I left NABH. So that is one good point. Second, of course, the recent right to healthcare in Rajasthan. What IMA leadership has been achieved, I think is the eye-opener, because this will prevent other states not to venture into this kind of initiative. So I think you have done a wonderful job and other states now will follow the same model. Now coming to आज का topic, मैं सिर्फ 8-10 मिनट लूंगा. Okay, next slide. देखिए ये क्योंकि मैं इसलिए आपको दिखा रहा था कि ये जो challenges हैं health care के, जिसके what we are going to talk about, the health for all. So these are the real, actually I rate always number one challenge which is put on the top, the negative perception. I think somehow I will again urge IMA to work on this. This is the greatest challenge which has hurt the sacred relationship between doctor and a patient. इसके ऊपर हमें काम करना है, because this I keep telling everyone, why is this negative perception? कई लोग कहते हैं कि डॉक्टर्स को कम्युनिकेशन हम ट्रेन नहीं करते हैं और बातें कहते हैं अबाउट द डॉक्टर. मेरे हिसाब से द सिंगल मोस्ट रीजन इज द कॉस्ट. एंड नन ऑफ अस इन दिस कंट्री, नन ऑफ अस आई एम सेइंग राइट फ्रॉम गवर्नमेंट, knows about what is the cost of delivery of a healthcare in present scenario. What Dr. Vijay Agrawal is saying, that today the longevity or life expectancy today has been doubled from the independence. Today it is 70 years plus. ये कैसे हुआ है? 70 years ऐसे तो नहीं हो गया. It has happened because of the concerted effort by the science of medicine, supported by the technology and wisdom of our doctors. उसकी वजह से ये आज हम 70 years पे पहुंचे हैं. So I think that is the single reason, because whenever people go to the private hospital, they just look at the cost and they look at the cost in the government, and government doesn't charge. But because public doesn't understand, doesn't know rather, and this is what I keep saying wherever I go in country nowadays, I tell the state health minister कि आगे से आप जब गवर्नमेंट हॉस्पिटल में ट्रीटमेंट करो उसको बिल बना के दो. और मैंने एवरेज फार्मूला भी बना के दिया था कि पर डे पर बेड कॉस्ट निकाल लो जो करीब 10-12 हज़ार आती है इन डिस्ट्रिक्ट हॉस्पिटल. 3 दिन का मतलब है 30,000 का बिल बनाओ, सब्सिडी 30,000 जीरो कर दो. एटलीस्ट पेशेंट विल नो that even in the government the cost came 30,000, and when he visits the private hospital, I think that perception will improve, and this negative perception और जो violence आप बात कर रहे थे ये इससे जुड़ी हुई है काफी हद तक. Anyway, I think remaining जो ये है, these are our challenges. Next slide. बाकी ये क्योंकि आज WHO का दिन था तो मैंने आपको कहा कि ये जो WHO ने burden of harm दिखाया है recent, अभी उनके वेबसाइट पे अगर आप जाएंगे, so I think we have to be conscious of these are our burden of the harm which all of us have to take into account. Next. Now, next please. Anyway, this is, by the way, I keep reminding you that Bhore committee independence से पहले बनी थी. 1940, actually 6 में बनी थी, 48 में report आई थी इसकी. And that time the committee made a simple remark that उस समय 92% healthcare आती थी government से, and remaining 8% आती थी trust hospital से और छोटे-छोटे private hospital से. And that committee said आगे से ध्यान रखा जाए that healthcare should be delivered only by the government, and I mean the same formula that 90% should be from the government. And आज क्या हो गया है? Almost reverse हो गया है. इसका simple reason है, I tell you. Simple reason ये है कि गवर्नमेंट के पास पैसा नहीं है. अगर हम 1.4% GDP खर्च कर रहे हैं, you can't expect health for all. So luckily 3.5% private sector is investing. Very few people know. 3.5% of GDP, it has actually increased now, is coming from the private sector. मिला के करीब 5% हो जाता है, which is reasonably, sufficient to carry on, provided government and private sector work in synergy. वो जिस दिन हो गया, I think health for all की तरफ हम थोड़ा सा आगे बढ़ना शुरू करेंगे. Anyway, this is the Bhore committee ने जो उस समय point लिखे थे. I'm just showing you. Next. Okay, next. This is, of course, Dilip was just telling me in the dais कि WHO ने क्या define किया है. Actually, universal health coverage का मतलब ये नहीं है कि free health care. हमारे political circle में इसको बहुत promote किया जाता है कि universal health coverage means free health care. बिल्कुल नहीं, ये गलत है. No country can give free health care to all. And by the way, none of the population also expect that they should get free health. What is the definition? Provide health at the cost which people can afford. So below poverty line को free दे दीजिए, above poverty line को 30% rebate दे दीजिए, और किसी को ज़्यादा दे दीजिए, और rich को कुछ मत दीजिए आप. That is the way you have to segregate. Then only I think government के पास जितना भी थोड़ा सा पैसा है, they will be able to achieve. But I think political compulsion ये है, they don't want to show कि हम लोग आपसे थोड़ा charge करेंगे. Co-payment की concept many countries are having. For example, CGHS. CGHS rates are unviable, everybody knows. Why can't the government say, okay, which are the hospitals which will do treatment at CGHS? Okay, 15 hospital आ गए. उसके बाद some hospital will say, I will charge 20% over and above, which patient can pay upfront, बाकी उसको government से आएगा. I am telling you, this scheme will become hit. Because then most of the good hospitals also will come into the CGHS, and many patients, they are ready to pay upfront 15%, 20% more money. So ये actually definition है universal health coverage की. Second point, next slide. Yeah, this is of course just I'm showing you for sake of it, क्योंकि Dr. Vijay ने भी ये कहा कि कब हम कर पाएंगे health for all. वो इसका data आपको मैं दिखा रहा हूँ. हमारे पास 1.75 बेड्स हैं पर 1000. कोविड से पहले 1.3 से बाय द वे अब 1.75 हो गए हैं, और हमें चाहिए मिनिमम 3.5 फॉर द डेवलपिंग कंट्री एज पर डब्ल्यू. इसका डबल, ऑब्वियसली कितना टाइम लगेगा डबल करने में, वी कैन अंडरस्टैंड. सिमिलरली जो एक चीज आ रही है यहाँ पे 0.9 डॉक्टर्स, लेकिन इसमें भी प्रॉब्लम क्या है कि इफ आई टेक 0.9 डॉक्टर्स, ये करीब हालांकि 1 हो गया अभी ऑलमोस्ट, बट दैट एक्चुअली इज MBBS को मिला के. And when we are talking of the delivery of the healthcare, we are talking of the specialist. उसका तो नंबर आई थिंक आप ही मुझे बताएंगे, शायद 0.6 है या 0.55 है पर 1000 पॉपुलेशन. वो डेटा मेरे पास एग्जैक्टली नहीं है इस समय. एनीवे, सो दिस इज वेयर एक्चुअली वी आर. ओनली एक अच्छा पॉइंट ये हुआ है कि हेल्थ केयर नाउ इज ए पॉलिटिकल एजेंडा. नाउ द पॉलिटिकल मास्टर्स हैव रियलाइज्ड दैट वी विल हैव टू फेस पब्लिक. And one of this question they will be posing us is the healthcare. Okay, next. Anyway, this is just data, just for sake of maybe young people who are sitting here. This is the data which is the important data. Just I want to highlight here because IMA के बहुत सारे members last section में बहुत predominantly आते हैं कि 30 bed and below हमारे 40,000 nursing homes हैं, which we consider next to the community. ये इंपॉर्टेंट है. एक्चुअली गवर्नमेंट हैज टू वर्क ऑन देम. इन 40,000 को हमने थोड़ी सी टेक्नोलॉजी लानी है इनके अंदर. वो उस तरह का इनिशिएटिव हम ले आए, बिकॉज इट इज वेरी डिफिकल्ट दैट वी विल ओपन 100 बेड हॉस्पिटल इन टियर 3 टाउन. वो पता नहीं कब होने वाला है. वेरी डिफिकल्ट. बट व्हाट वी कैन डू इज टू रेज द लेवल ऑफ दिस 40,000 नर्सिंग होम्स विच कैन हेल्प इन अचीविंग द हेल्थ फॉर ऑल. नेक्स्ट. ये जब मैंने आपको डेटा दिखाया, देखिए ये जो है 70 years है. IMR रिमार्केबल इंप्रूवमेंट हैज टेकन ऑन. IMR MMR बहुत अच्छा हुआ है. फर्टिलिटी रेट आई थिंक दैट इज ए गुड साइन इन ए वे. 2.14 पे चल रहा है इस समय. इफ वी कैन अचीव 2, आई थिंक इट इज गुड फॉर द कंट्री. बट यहाँ पे ऑफ कोर्स वी विल हैव टू वर्क टू इम्प्रूव द IMR. हमें 7 या 8 पे लानी है, बिकॉज इफ श्रीलंका कैन हैव 11, आई थिंक वी आर एट 26. तो इसके ऊपर हमें काम करना है. ओके, नेक्स्ट. एनीवे, इलनेस टू वेलनेस definitely is the one, because the studies shows that if you spend 1 rupee on preventive healthcare, you can save 5 rupees on the curative healthcare. I think this is the area where again I think IMA can take जो आपका गांव चले वाला कंसेप्ट है, आओ गांव चले, इसमें अगर हम इसको एजुकेट कर पाए, I think we will be able to inching towards the health. Next. Okay, I think this is the road, last slide, जो आपको बातें अभी बताई. I think I am trying to sum it up. मेरा एक recommendation ये है कि if IMA, and because Minister साहब यहाँ पे थे and he happens to be a doctor, which we didn't know this. अगर हम PGI colleges ज्यादा खोलें, इस समय you see MBBS की सीट 2014 में थी 50,000, आज 50,000 के अब 1 लाख हो गई है. Now, and हर एक डिस्ट्रिक्ट में कॉलेज खोला जा रहा है, बट पीजी सीट अभी भी करीब 55,000 है. तो वी आर नॉट एबल टू मैच द गैप. तो अगर आप थोड़ा सा ये इनिशिएटिव लें और गवर्नमेंट को कहें, जैसे पीजीआई चंडीगढ़ है, उस तरह के कुछ और इंस्टीट्यूट खोले जाए, सो दैट दे ओनली confine on PG education, because otherwise the number of specialists we will not be able to match. So that is, I think, my strong recommendation. बाकी तो ये जो restructuring of the government scheme, actually this is agenda AHPI and IMA have been fighting with the government, क्योंकि गवर्नमेंट के पास पैसा नहीं है, इसलिए वो जो रेट फिक्स करते हैं CGHS में या आयुष्मान भारत में, वो उससे देखिए ये पेपर की बात है कि 500 करोड़ पॉपुलेशन इज कवर्ड. ये एक्चुअली इट इज ऑन द पेपर. एक्चुअली कवरेज इज हार्डली 40% ऑफ दिस नंबर. एंड ये तब तक नहीं होगा जब तक हम वी ब्रिंग मोर हॉस्पिटल इनटू द फोल्ड, एंड उसके लिए हमें जो कंपनसेशन है, रिइंबर्समेंट है, वो करना पड़ेगा. आई थिंक दिस ए फाइट वी आर डूइंग टुगेदर. होपफुली वी विल बी एबल टू अचीव. सो आई थिंक दिस इज इन शॉर्ट के हेल्थ फॉर ऑल अचीव हम करें कि नहीं करें, बट वी हैव टू वर्क फॉर इट, एंड दिस आर द वे वी कैन बी एबल टू अचीव. थैंक यू वेरी मच.
I'm sure you will agree that the wisdom of Dr. Gyani was so evident. He was brought out several, fantastic points. And I must say, to highlight that economic perception is a huge area where we'll request Indian Medical Association to also focus and try to get this kind of a studies, corrections, everything. The other thing which I find sometimes like so what you said, and that is the ratio that we have, whether we have 0.9 per thousand or whatever doctors, I do not understand. Plus, I understand that I think India is #1, a continent, not even a country. And therefore, if you were to take just this ratio of the state of Delhi, they will be hugely different when you go about just 100 kilometers from here. So can we at least have a district-wise these ratios to be present? Because every time when somebody presents this, some rich man hears about it and opens another hospital in Delhi or nearby. He thinks there is a huge shortage. And the fact is that there is no shortage. In fact, you will have much more than probably anywhere else in the world. The kind of the doctor-patient ratio or even the bed and the patient ratio. We need to now, and I will request Indian Medical Association, because you are absolutely in the right position to have this study district-wise or even on a smaller scale, that what is the ratio? What are the exact ratios of this kind of a figures? We do not have, and it's unfortunate. I must also, of course, say that today in this Health for All, I must compliment the government for one thing, that now their focus on sanitation and maybe potable water and those things have definitely improved, which is a huge, huge input for making Health for All. So now I request my friend, Dr. Puneet Mishra, who is heading the Public Health Community Medicine in All India Institute, and especially to talk about the burden of non-communicable diseases and where we ourselves are responsible.
Thank you, Dr. Vijay, for inviting me, and thank you, IMA, for giving me this opportunity to share a few of my thoughts with you all, with all the distinguished guests who are here. I have a presentation, but before going into the presentation, I would share a few of my thoughts regarding non-communicable diseases and why it is important. Today, at the time of inauguration, when Dr. Sarad was mentioning that IMA has a project of Gaon Chale, then I realized that how well IMA is thinking in terms of providing the healthcare to the population of our country. Around 70% population still lives in the villages, and they do not have the kind of healthcare which is available in the big cities. When we say like doctor population ratio, we all know that it is concentrated mainly in the big cities. The other issue, before going into my presentation, which has mainly the figure data, why non-communicable diseases, they are so important. There is another thing that what's happening in the country, there's a transition from communicable diseases to non-communicable diseases. When we were a student, it was mainly the communicable diseases which were issue, but now it is non-communicable diseases. The other issue, this data I would present in the presentation. The other issue which country is facing, if we see in the term of non-communicable diseases, I'm more worried as a public health professional. We have a huge population, around 1.4 billion now. And if you see our age pyramid, majority of our population is young. If we go to West, in the Western countries, the non-communicable diseases, cardiovascular disease, diabetes, they usually affect individuals in their 50s and 60s. But what's happening in India, because of different reasons, it's affecting young. So what are the consequences? Suppose a person who gets a diabetes at the age of 30 years, that is a productive year. They are economically productive for the country. That is the workforce. So suppose our young people, if they get these chronic diseases, suppose a person gets a diabetes at the age of 30 years, 35 years, maybe next 15, 20 years, they would have different long-term complications. So besides the treatment cost, there would be other costs as well. And we will lose a person who can be economically productive for the country. So we have to think in those terms. And since I said that most of the population live in the rural area, so we have to focus on our services there as well. The other thing why there can be a role of IMA, still in the country, more than 70% of the care that is provided by the private practitioner. And most of the private practitioners, they are part of IMA. So I think IMA can play a very big role in this transition which is happening in the country and to provide the care. So now with these things, let me share some data, and that is mainly this presentation. Since I'm from academic background, I'm a teacher, so I'm used to present the data, and I'll go very quickly. There are many slides. I know I have hardly 4-5 minutes left, so I'll go very quickly with the slides, and then if there's any question, I'll answer at the end. So please, next slide. I'll miss many of the slides, and then next slide, please. So next, I'll not take the next. Next. So non-communicable diseases, we know they are chronic and usually of long duration. And the message here is they disproportionately affect the countries which are low and middle income countries where we stand. If you see in the terms of global scenario, so that is the situation. And NCDs, they are affecting more in the low and middle income countries. Next, I'll skip this slide. 80% of, next. So these 4 diseases, cardiovascular disease, cancer, chronic respiratory disease, and diabetes, here lies the 80% of morbidity and mortality. Next. 74% of the deaths, they are globally attributed to non-communicable diseases. So huge burden of non-communicable. I just wanted to show here that in terms of death, if we see the major contribution is from the non-communicable disease. And here we are more concerned about the death when they are premature, because ultimately one has to die, right? Whether because of communicable disease or non-communicable disease. But the important thing is premature death. That should not occur. If a person gets disease, non-communicable disease early and dies prematurely, then it's cause of concern. Each year, 17 million people die from NCD before age 70. And 86% of these premature deaths occur in low and middle income countries. So that is the situation. Next. This I just wanted to show the burden, but we all know that the burden is increasing. Whether it's India, it's other countries, the burden of non-communicable disease, that's on increase. Next. Now, the question here is, if you see deaths in 2016, 67% of the deaths, they were because of, they were because of non-communicable disease, but the budget which was allocated for non-communicable disease or spending on non-communicable disease, it was only 2%.
So for previous slide. Next slide.
That would be easy. Thank you very much. So the same, I mean, it's about the funding of the 2%, the 42% of the funding, it came from different NGOs and foundations. If we see the magnitude of non-communicable disease in India, the deaths due to NCDs have increased from around 38% in 1990 to 66% in 2022. This is the proportional mortality due to different NCDs in India. CVD burden, you can very well see the increased prevalence, a high prevalence of cardiovascular disease, ischemic heart disease. Diabetes burden is quite high, and India is many times it is called as the diabetic capital of the world. And it accounts for 17% of the total number of diabetes patients in the world because of two reasons. One, we are a huge population, that's number one. Number two, there's a higher prevalence of diabetes. Now younger, you are a clinician, you know, now more and more younger people, they are coming with the diabetes type 2. So then COPD, cancer, if we see around estimated number of people living with disease is 2.7 million, and every year around 1.39 million new cases are registered. So these are the few cancers, some statistics. Dailies about NCDs. So India had 33% of total dailies from the diseases. Now it is 55% from NCDs. So if you see communicable, then maternal, neonatal, and nutritional disease, it was 60% in 90, and in 2016, if you see, it was around 55%. This is just to show economic burden, which I was talking about. Because of different disease, it's a treatment cost, another cost, not taking into the account, which we are going to lose if we lose the young people in the terms of economy. So what should be the public health approach to manage, prevent, and control in Indian context? I'll not go into detail. We know the main area of management is lifestyle modifications, dietary modifications, early diagnosis and treatment. The issue here is, these days, even as a doctor, if you see most of the public, when they come, they want some kind of pill. Give pill for it, but if you say, okay, do exercise, do dietary modifications, it's very difficult. But that is the mainstay of control on management of non-communicable diseases. I'll not go into detail of these things. You all know about it. Then India has a program, NPCDCS, for non-communicable diseases. And mainly it is for the rural area. It was launched in 2010, and then in 2013, it has been amalgamated with the National Health Mission. So now it is being implemented with NHM in the country. And this is the program through which Government of India is reaching at the grassroots level worker, at the sub-center, health and wellness center, PSCs, CSCs. And so this is kind of flagship program where screening and other activities we are doing, like health promotion, opportunity screening, and prevent and control chronic diseases, capacity building, support diagnosis, cost-effective treatment. So then about the National Action Plan, there are certain action points to achieve NCD goals, targets, and certain outcomes in terms of early detection and timely treatment leading to increased cure rate and survival, a reduction in exposure, that is to the risk factors. Because as you know, for communicable disease, they are disease agent, but here it's the risk factors. So there are many challenges in terms of controlling NCDs. And the way forward, if we make a program, especially for the country where we can do screening, we can provide right kind of education, probably we would be able to achieve some success in terms of NCD. Thank you very much for your listening. And now I will be happy to answer your question. Thank you.
Thank you, Dr. Mishra. And now I'll request Dr. Dilip Kumar to address, I think, is one of the biggest challenges as we see is the capacity of providing healthcare. And in that, nurses will be on the top of the list. So over to you, Dr. Dilip Kumar.
I think it's a difficult time after the lunch. So much time you people are there, you are all tired. And nursing comes at this stage. You can imagine the attention and retention on the part of the I think Ibaska psychiatrica, because I am also psychiatrist, I am also psychiatric nurse, so I can understand. So distinguished dignitaries on the dais and off the dais. First of all, on behalf of the Indian Nursing Council, I would like to extend greetings to all of you who have joined on this occasion of the World Health Day. The theme of the World Health Day, I think you heard in total about the definition of the health and also whether the 1978, at least I had a fortunate to be in the Ministry of Health when all those primary healthcare, health for all, Alma Ata Declaration by 2000 AD and preparing so many manuals. And at that time, the Director General used to tell me, because I was looking after the female health worker program, auxiliary nurse midwifery program, Dilip Kumar ji, ये red book है ना, ये red book पढ़ने से MBBS doctor बन सकता है. So voluminous, it captured all what we are talking about, the maternal and child health services and the immunization, expanded immunization, reproductive child health. I think a diversification has taken in the health policy planning. First of all, I would like to congratulate the Indian Medical Association for organizing this World Health Day celebration, starting by morning by the walkathon, where the doctors and nurses had this walkathon, and inviting the nursing professionals to participate in this very important World Health Day celebration. How important, I am going to tell you how the globally the World Health Organization prioritized this our integration and the participation in the health for all. And especially not only inviting us, asking us to identify 12 outstanding nursing professionals to be given the award. That's a very, very good initiative. And I always, in my, whenever I am preparing the syllabuses, preparing the various policy plans, we work as a team member in the healthcare delivery system. As you all know that the doctors, nurse work hand in hand in the healthcare delivery system. And in a healthcare delivery system, you all know that human resource becomes a very important block in the healthcare delivery system. And in the human resource, again, nurses happen to be the largest human resource in the healthcare delivery system. Therefore, if at all, if we have to sincerely go, whatever the definition, health for all or health accessibility, I think good you have thrown some, I think the the country director who was here, he should have been listened to your talk so that he could have passed on the message. Some committee could have been constituted for revising the definition of health. So, so we, the nurses and midwives, are the largest human resource in the healthcare delivery system. But you all showed the, I think Giridhar Gyaniji has given the population ratio and all. I am also going to give the one indicator that itself speaks volume of the where are we. So, but still there is a need to strengthen this block of human resource in the healthcare delivery system, if at all we are very serious to achieve the health for all. The theme of the World Health Day 2020, because I would like to go back how World Health Organization has laid down the emphasis on the nursing sector at the global level. The 2020 was the theme of the World Health Day, was the theme, I am telling you, theme itself they have coined to support nurses and midwives, which itself shows how World Health Organization has, after the COVID-19, they have laid down the theme itself with to support the nurses and midwives. Coming to the 2020, to commemorate the 200-year birth anniversary of the Florence Nightingale, and also the theme of the World Health Organization 2020 for the nurses and midwives, the Lord Nigel Crisp, who was I think many of the corporate sector, I think that's what I can see, that you people are all, how in the United Kingdom, he was the health secretary, the retired now health secretary now, and now he has become Lord. Now the Lord Nigel Crisp took the initiative to the World Health Organization and also to the International Council for Nurses, because he saw in the healthcare delivery system in the United Kingdom how nurses and midwives are contributing. So he was knowing that they are not being properly looked after, and also they are not properly evidence-based, how some of their evidence practices are not being properly implemented, how it is affecting the cost. So in that perspective, he took the initiative to the World Health Organization and to the ICN, and they were able to come out 2020 as an International Year of the Nurse and Midwife. Imagine the World Health Organization 2020 declares as a year of the International Year of the Nurse and Midwife. Unfortunately, globally, nursing fraternity, or even in India, we could not celebrate that euphoria of the International Year of the Nurse and Midwife because of the COVID. But that COVID-19 gave an opportunity for the nursing sector. The visibility of the nursing sector in the eyes of the public has increased. You might have seen how many of the our own medical professionals come and tell me, Dilip Kumar, मेरा brothers 2-3 डॉक्टर था, वो आके मेरे में हाय किया, मेरे को कोई टच ही नहीं किया, बात ही नहीं किया, आप ही के नर्सेस लोग ही आके टच किया, बात किया, and they were able to look after us. So at least know what while working in the ministry, why the funds are not given to the nursing sector, why the priority is not being given to the nursing sector. That's why today somehow or the other our nursing sector is not able to get the political support in terms of the prioritizing the allocation of the funds to the nursing sector. Though at least in the year 11th plans, I started as a nursing advisor in 1994 with a 40 lakhs as the budget provision for the development of nursing services at the national level, 40 lakhs in 1994. When I landed into 10th plan, the budget I was able to take to the 80 crores, 10th plan. And in the 11th plan, we were able to give the justification to the planning commission. We asked 5,000 crores. You heard me surprising how a sector came starting from 40 lakhs to show that absorbing capacity. Generally, bureaucrats will ask, where is the absorbing capacity आपके पास है? आपको पैसा देने से भी आप खर्चा करना चाहिए ना? So therefore, we were able to show the absorbing capacity. We were able to reach out to the 80 crores, and in the 11th plan, 3,220 crores. That was the level we were able to project the ministry. So in that perspective, Lord Nigel Cripps was able to advise the Tedros. I think at that time he just was taking over as a DG, and the chief scientist post, which is the only one post is available in the WHO headquarters in Geneva. That is the highest post a nurse can aspire to reach globally. The chief scientist nursing was vacant for the last 10 years. Only about after Dr. Tedros joined, the post was filled. I, being at the Global Advisory Committee on Nursing and Midwifery, one of the members, we are 18 members. The DG Chang, we met her as a Global Advisory Committee members. The reply was just like we were getting in India. Then I realized, oh, this is a global phenomenon. Whatever we get in India, there are no money. Please ask some sponsoring companies to sponsor the money. I am telling you, this was the response. And Tedros, when he took over as a DG, he was able to fill up the post of the chief scientist nursing. So the DG WHO, I think because of the intervention of the Lord Nigel Cripps, first time World Health Organization is bringing out State of the World Nursing Report. It's called SON report. State of the World Nursing Report, which captures the evidence-based practices of the nurses and midwives globally, which has been captured in this SON report. And they, while launching on the 2020, on the April 6th, because 7th was his theme was there, April 6th is launching. While launching, he makes a statement, I quote, "Nurses are the backbone of any health system. Today, many nurses find themselves on the front line in the battle against COVID-19. This report is a stark, because he himself is telling, this report is a stark reminder of unique role they play and a wake-up call. He is telling the wake-up call to ensure they get the support they need to keep the world healthy. He also coined at that time, without no nurses, no universal health coverage can be achieved. This is his quotation, the Lord Nigel Cripps. So therefore, the World Health Assembly, he never stopped there. You know, like in India, many CCH resolutions will come up, Central Council of Health resolutions, many resolutions will go to the states. So we also, World Health Assembly also passes the resolution. It is called Strategic Direction for Nursing and Midwifery, SDNM 2125, because the WHO works for a cycle 4 years, SDNM. So they made a strategic direction for nursing and midwifery. The whole theme of the whole SDA, the State of the World Nursing Report, captured the 4 themes. Number 1, they know that globe is telling to all the countries, investment is not there for nursing. Very clearly, they are pointing out in this report, investment. Number 2, the creation of the jobs. The problem is, we always tell that quality of the nursing care is not there. If you don't appoint the nurses and midwives on the basis of the approved nursing staffing norm, how can you expect the quality? The same nurse, when she goes to the overseas, she is outstanding. Whereas in India, they say, no, she is not taking care. Same syllabus she has passed out because she is getting a very good working environment. And also the optimum nurse-patient ratio is given to her. Definitely she is outstanding. So therefore, the global report says the creation of the position. It says number 2, theme of the whole report. Number 3, the leadership. They say the nurses working in the various clinical settings, they have to coordinate with the various disciplines in the healthcare, in the wards, and also in the clinical level. They should have effective leadership skills. Then only impact and outcomes are going to be there. That's why they said the leadership is one. The last is the service delivery. They have said that if you don't provide the appropriate environment, ecosystem for them to function effectively, so it's not going to make an impact. Therefore, these are the 4 themes which have been reflected in that theme. So that then I think at least in that context, our Honorable Prime Minister called, I think you all know that how he called up the one nurse from Sister Chaya from this the Civic Run Hospital in Pune, which has been treating the COVID-19 patients, and applauded the work done by the nurses. That itself, at least our Honorable Prime Minister was able to show the magnanimity of identifying the nursing sector. In pursuance of these, whatever the resolutions, for these resolutions, which has been now, at least the government of India has made some of the policy initiatives. I support those policy initiatives. At least the big policy initiative they have announced is they are going to train 84,000 nurse practitioners, midwives. That's a big policy commitment, not only to train. I think many times investment, whatever that state of the world nursing report is telling, but in that perspective, the government of India said we are going to train 84,000. Not only they have said we will train it, and also we are going to have midwifery-led units, where the sustainable development goal for the IMR and MMR has to be reduced. They should have the big strength of the nurses and midwives. Therefore, they said they are going to have, it's a big policy announcement they did. And also you might have seen that how the Ayushman Bharat, which 150,000 sub-centers are there, which are in the country, have been converted into health and wellness centers. And they have added the position of the community health officer. It is also called as a mid-level health provider. And they saw that the ministry gave a guideline to all the states. You can, yes, I will take two minutes. They said Ayurvedic doctor or the homeopathic doctor and a nurse, they said. Majority of the states have preferred the nurses because they have seen the syllabus of the BSc nursing is in tune with the duties and responsibilities been given by the government of India. So therefore, the 150,000, this thing, the mid-level health provider, the point why I am making is mid-level health provider, they are going to be providing the basic maternal and child health services, which are mostly covering to the 70% of the population in the rural area, where the health for all has to be reached, because that is the population which these our nurses and midwives, where the positioning at the sub-center is going to make an impact. So that is another big initiatives and which has come up in this. And the future, I would like to say one of a very important point, where I think you were talking about the bed population ratio and also. I would just come, at least any country is going to be assessed by what is the nurse physician ratio? Because since IMA is more concerned with the medical people, I am going to tell you that at least the international norm is there should be 3 nurses for 1 doctor. That is the international norm. And in developing countries like Japan, you have a 4.6 the nurses for 1 doctor. You have in USA, you have 4.1 nurses for 1 doctor. Canada 3.9, UK 2.8, whereas India 1.9. Even this 1.9, this data is not a reliable data. Like Medical Council, Indian Nursing Council, if a parliament asks the question, how many nurses and doctors are there in India? We say, we don't say how many are there. We say 24 lakh nurses have been registered from 1947 to date. So if you go with the data, reliable data, it's going to be far disastrous if you go with the. So at least Indian Nursing Council, we have started a live register. It's called Nursing Registration Tracking System. What the district planning you are mentioning, in this nursing registration tracking, collector will be able to press that New Delhi. If they press the New Delhi district, you will be able to get the number of the nurses and midwives with the specialization you will get it. So that type of a nursing registration tracking linked with the Aadhaar has been captured. We have a 10 lakh, about 11 lakh nurses Aadhaar linked to the data we are having. So within another 1 year, we are going to capture the whole data. So that time we'll be able to say what is the correct ratio. So therefore, there is a.
We are getting very angry looks from the.
Okay. So therefore, the nurses and doctors have to work together to make the healthcare delivery system, and in order to achieve the health for all. And once again, I would like to thank the organizers IMA for giving the opportunity to me to share the points and including our nursing sector in this WHO deliberation. Hope this type of will continue every year. Thank you very much.
Thank you. Thank you, Dr. Dilip Kumar. And we come to this end of this session. While ending, I'll just like to say one thing, that we are for providing health for all, let's say the all medical fraternity, the doctors and the nurses, we have to consider ourselves like to be the pillars of providing health. But I must like to point out that medical errors are at the moment a leading cause of death all over the world. Even in a country like United States, where they are spending the money almost equivalent to our GDP, the medical errors are the third leading cause of death. And therefore, I would just like to end this, that while we are there for health for all, I would like each one of you to get sensitized to this issue of medical errors, patient safety, and that is at the root of many other problems. Please look at it. Thank you very much. And thank you for your patient listening.
Thank you. Thank you, Dr. Vijay, for a very, very, very absorbing and very, very informative webinar or seminar on the theme Health for All. And I'm sure we have an illustrious panel, and we have every sentence of yours has gone, I'm sure, it has been an information to all of us. And I can only assure you that today's session will keep us more close, and we'll keep having such sessions in future also. Thank you very much. And now just a minute, we have a onerous duty, and I'll request our national president to honor our worthy speakers and chairperson with the respect of memento to each one of them. Yes, sir. Thank you. Thank you, Dr. Vijay. Thank you, Dr. Puneet, Dr. Nimesh, Dr. Girdhagyani, and Dilip ji. Thank you. Thanks a lot. Thank you. But please be there for the next session. You will definitely be, we will be very, very friends. Thank you. Thank you. Friends, we have a very, very important and very sensitive issue of and a discussion on issue of integrated medicine. I am filling the gap of a person. I am sure I will not be able to reach 10% to him, is Narottam Puri. Narottam is not well and had some fever, so he showed his inability to come. And unfortunately or fortunately, I have been given this onerous responsibility and duty to fill in the gap in place of Dr. Narottam Puri. Friends, I request all of you to please settle down. We will not take much. Please settle down. My personal request to all of you, please settle down. Friends, the issue of integrated medicine has been very, very sensitive to medical profession. It is a very important issue for medical profession too. It is a confusing issue also for medical profession. I am sure the more it is confusing to the medical profession, it is confusing to the administrator. Every year, a new terminology comes in, whether it is jhola chap doctors, whether it is training the healthcare workers, whether it is training the, one pathy of doctors to give another pathy. And they go with a whim and with a fantasy that doctors are less. And with this theme that doctors are less and doctors are not going to the villages, which has been documented, I'm sure 20 years back. Now, with the same, when we are producing more than 1 lakh doctors every year. We are producing 60,000 postgraduate doctors every year. And for one post, at least hundreds of doctors apply. In that situation, still if the government keeps talking that we have to come out with a system so that every doctor reaches to every corner of this country, I can only say that this is a misrepresentation of facts. Not only misrepresentation of facts, I can say that it is a mal or mismanagement at the place of administration. And that is why Indian Medical Association has been very vociferously talking about Indian medical services. We feel that the healthcare in this country should be managed by not ill-informed administrators, but with well-managed and well-informed doctors as managers and administrators. And that has been the theme about it, friends. We have a very illustrious panel. I'll request Dr. Sanjeev Kumar, a very, very dear friend of mine. When I was the president of Delhi Medical Association, he was looking after the UNICEF office in Delhi, and we came close to each other. Graduate from All India Institute of Medical Sciences, joined UNICEF, and then now on various positions. He's now a past consultant of UNICEF in that capacity, and has been nutrition and all these issues has been very, very close to him. We have another very important speaker, very illustrious person, a voice of medical profession on various channels, a person who has been creative as far as All India Institute of Medical Sciences is concerned. He has been the one who is known for creating trauma center, has been absolutely able administrator, is none else than Professor Dr. M.C. Mishra. Friends, a very respected Ayurvedic practitioner. And we have, shared the media platform on various channels, and he's none else than Ayurvedacharya, Dr. Parmeshwara Arora, a very dear friend of mine. I'll request him to come here. And now we have none else than voice of Indian Medical Association, not only today, in future also, is Dr. R.B. Ashokan. Dr. R.B. Ashokan is the president-elect of Indian Medical Association. Please give him we give all our panelists a big hand. I know the constraints of time, and I also know the importance of this topic. I also know that the entire country is boiling on this issue as far as medical profession is concerned, because every time we get a new terminology of training, whether they are healthcare workers, whether they are doctors of different pathies, and whether they are asking them to practice with only one whim. And I'm sure 20 years back, their files must be saying that doctors are less. And with that myth, they are planning their, every year they're planning changes and saying that doctors are not going to the villages and not going to the primary health centers. Friends, I'll request I'll start with Dr. Sanjeev Kumar, because he has been one who came in contact with me as far as public health is concerned, for the first person to be in touch with me, Dr. Sanjeev Kumar. Sanjeev, please.
Thank you, Vinay. I don't know after how many decades I am back, though I am a life member of IMA, but I am back in an IMA function. And we had organized many meetings, bringing IMA on board on universal salt iodization, oral rehydration therapy, baby-friendly hospital. In fact, the Secretariat for Baby-Friendly Hospital was located in IMA headquarters. So very sweet memories, and I am very happy that you are talking about issues which are very close to people's health, if I can use that word. And when I get confused, and during my work in public health as well, I start looking at things from public point of view. So when it comes to integration, what is people's perspective? And when I was in NHSRC, we did a study across 18 states in India, looking at how much is Ayurveda into their day-to-day life and how they feel about Ayurveda and modern system of medicine. 73% of people tried socio-cultural practices mostly derived from Ayurveda before they came to modern medicine hospital. So when it comes to people, they want both. The second perspective I look at it from doctors or healthcare providers' perspective. And I teach leadership and management. And the best manager I've come across in my life is the housewife. When she prepares a meal, she gives you dal, she gives you 2 vegetables, rice, chapati, whatever she makes. But she doesn't say, पेट में तो जाके सब कुछ मिलना ही है, तो दाल सब्जी सब एक जगह बना दो, चावल भी एक जगह, आटा भी एक जगह, and then you have this dish. So from service provider's point of view, you have to look at it how a housewife looks at a meal. So if I, as a general public, I want to go to an Ayurvedic practitioner, I go to Ayurvedic practitioner. If I want to go to modern medicine, I go to modern medicine. If I want to go to homeopathy, I go to modern medicine. But we don't mix up things like housewife doesn't mix. So that's the healthcare provider perspective, which is third perspective is systems and government perspective. They are always in a hurry. And I think in the morning, somebody said they have political compulsion. So they have to do things, and not only do things, need to be seen to be doing things, even if things are not really happening. But, the propaganda is there that they are doing something. So we need to look at policy, organizations like IMA and institutions like All India Institute of Medicine, Nursing Council. They need to provide support and sense to the people who decide on what the system needs to look like. And that's what we are doing in this meeting today. And we will be sending that. What about the attitude of the service provider? The same study we did across 18 states, we asked the doctors. 70% of the doctors practicing in public health system felt, yes, Ayurveda, homeopathy, and other systems of medicine do provide some relief to the patient. So we have no hesitation in referring them. So co-location, which the minister mentioned, is already happening under National Health Mission. So we need to look at bringing them together so that people can go to one room or the other room, but we don't mix up. So that's how I look at it. Thank you so much.
Thank you, Sanjeev. A very crisp message by you in this regard. And now I'm sure I'll request Dr. MC Mishra. Dr. Mishra has been sharing this discussion on Ayurveda versus, unfortunately, versus modern medicine, which was very unfortunate. And it was in relation to Baba Ramdev and other issues, which we will not be touching that. But I'm sure Dr. Mishra has very clear, lot of clarity on the issue of integrated medicine. And now I'll request Dr. Mishra to come. I just want to give you one information which can become, see, Ministry of Ayush was made with the aim so that they are able to develop Ayush departments. And with that, lot of funding was also given to that. A separate ministry was created, and this time a separate minister was created of independent charge of Ministry of Ayush. I'll give you one information that out of 259 Ayurvedic colleges, which Dr. Parmeshwar Arora will share with me, in the last 3 years, only 8 Ayurvedic medical colleges has started. Only 8 medical colleges. And 2 homeopathic medical colleges have started, out of which one is still in the process of making. Now, I do not want to say that is this a incompetency by the Ministry of Ayush, that they have not been able to create institutions where, or research institutions where that particular pathy develops. They do research and they come up to the level that even the world looks at them from a different perspective, and to say, if we have to take ancient medicine, if we have to take Ayurvedic medicine, go to India. But instead of creating that institution, instead of creating that research facilities, I'm just giving you the fact which we have taken from a, question asked from the ministry, that how many medical colleges are there, how many colleges are private private area, how many are government area, how many have been started recently, and that is what information I'm giving you. Dr. MC Mishra, sir.
Thank you so much, Dr. Vinay Agarwal. You are the esteemed emeritus chairman of IMA, I consider. Dr. Sharad Agarwal, the president IMA, chairing the session here, and Dr. Sanjeev, Dr. Arora, and Dr. Ashok, and Dr. Desai, Dilip Kumarji spoke at length about nursing problem. I don't know how much you have appreciated my role empowering the nurses. I'm not sure. So that is what I could do at Trauma Center, create a model of empowering and strengthening the nursing in our country, giving them many opportunities, and they are excelling. And when they go abroad, naturally they excel. When they learn here, they go abroad, they'll excel. Doctors, nurses, both. Puneet spoke about NCDs. He missed out on one, which I will little bit touch upon that because that's my area of concern. The trauma is also disease. Please consider injury as a disease, and it is disease of the young between age 5 and 50, and then at our age we fall and we break our hip. So that's another spike. In India alone, we lose almost 200,000 lives every year, young lives on our roads and other unintentional, intentional injuries. And when we say behind each death, there are 12 to 20 times injured, severely injured individuals in the country. Puneet also spoke about dailies, about other diseases, diabetes, cardiovascular diseases. When I consider in 2020 onwards and 2023 we are in, disability adjusted life year lost. Dr. Desai would agree, the top is cardiovascular diseases. Next is mental health illnesses. And number 3 is injury, Puneet, today. It's not diabetes, it's not some cancer. Even if you take cancer, it's a problem. It's a problem because numbers in India, everything 140 crores, numbers will be huge for everything. Breast cancer, which is the commonest cancer in the country, its incidence is still 1/5 of that in West. And we should not lose that advantage. This is what I say, by keeping to our diet, keeping to our lifestyle. Don't become American in our Zomato and all those things. All these measures we have to take. The children today, they don't eat at home. I think, Sanjay, you said very well, the dal, sabzi and roti. Children don't want to eat that today. Where are you going to have that healthy life? They want things from Zomato, delivered at home. They just don't like what is cooked at home. So I think there is a whole cultural change which is happening, westernization of Indian society, which is unhealthy. Similarly, the healthcare is going the American way. Whether it's private healthcare and we think about other problems, so that will not solve our problem anyway. So what I was saying, injury, we consume globally $500 billion a year on injury care. Whether we want it or not, whether we like it or not, that we have to understand that. And I agree with Vijayji, who said before, there is an oversupply of hospitals in urban India today. Like he said, everybody will look at, yes, there are so many people, there is a need for a hospital, there is another hospital. But Dr. Vinay, you know, Dr. Sharad, you will know, everybody knows every hospital needs more patients. Every corporate hospital, every private hospital needs more patients. They're looking for more patients. They are doing health tourism. We are not able to, we are discussing how to provide health for all to our citizens, while we are looking for patients coming from overseas for treatment. And we feel proud of it. Okay, it's a good for country. Country is earning money. So that's good for that. But we are not able to give liver transplant to our own people, but we are giving to people coming from overseas. So there is a dichotomy in India of all kinds. So that is something I wanted to touch upon. And then as regards integrative care, Vinayji, I am for it. I just visited Varanasi BHU, where they had the Ayurvedic college had organized a conference. Because we conducted the first trial of Shar Sutra, published in 1991 under ICMR, 4 centers in the country, PGI Chandigarh, GMC Chandigarh, AIMS, Wardha, Sevagram, and KEM. And we published that data that Shar Sutra is very effective in curing anal fistula. And I still practice. Even in private practice, I do Shar Sutra treatment for anal fistula. I don't do conventional treatment, and that is effective. I saw how many patients were being treated in BHU with this technique. We have not been able to adopt it in our curriculum, surgical curriculum at NMC, which now I am going to push for it at least in national board. At least this established procedures, established medication, established therapy for something needs to integrate with allopathy, because allopathy doesn't have answer for everything. And we have to understand the limitation. I know how many people with ulcerative colitis are benefiting coming to these places in India. So how we can help? Ultimately, integration is for the patient. Where yoga will help, where diet only will help, where some Ayurvedic medicines, of course, we are not knowledgeable about Ayurvedic medicines. So naturally, we don't prescribe those. But if there is going to be some benefit to us, and we all use at some time or the other, we all have used homeopathy also, Ayurvedic also, and we know today the cost of medicines has hugely gone up. So if at all we want to bring down the holistic care, health for all, allopathy is not the answer for that, the way it is practiced today. Because prevention is much better, as I think you mentioned. Dr. Gyani mentioned, if we prevent, we spend 1 rupee. If we cure, we spend 5 rupees. That's what he mentioned. So I think that is where we have to look at this, instead of making silos, that this is Ayurvedic silo, this is allopathic silo. Ayurveda is a science. It is not something like homeopathy. Homeopathy, a lot of people don't believe. NHS doesn't permit. In UK, they don't permit homeopathy. But Ayurveda is a science, and wherever we can, like, kaise khana hai, kab khana hai, kitna khana hai, and that is what today we are saying. Reduce your diet by 10%, increase your water intake by 10%, increase your walk by 10% to remain healthy. So promoting this kind of a lifestyle, and in Ayurveda, there are a lot of practices, and we all follow those practices. One thing which I want from IMA, and Dr. Sharad is sitting here as a president, to do something for injury prevention. And IMA actually can contribute immensely by creating awareness amongst our own people, as well as IMA has branches in every small places. And some IMAs, CMEs and programs I've been going to create awareness about injury prevention, because injury is a disease. Breast cancer, I may not be able to prevent. It will happen. We provide access to healthcare and we treat. But injury is a preventable disease. We can inculcate that culture. 72% of automobiles on our roads are 2-wheelers. They are not 4 wheels. It's just economics of the country. And head injuries, 90% times can be prevented if somebody has put on a helmet and fastened it. And our own doctors do not put that. So I think I will end here. And if there are any further discussions, we'll thank you.
Thank you, sir. And thank you for your very, very learned views on this issue. I just want to say one thing, that there is a lot of clarity on the issue of whether it is a holistic medicine or an integrated medicine. And as Minister of Ayush also, who was here, has said very rightly, that it is coexistence of various pathies at a place. It is not mixing. What Indian Medical Association is against is mixing of these pathies, and is mixing to an extent that recent circular or recent thing says that in first or second year of MBBS, there will be Ayurveda or other pathies will also be taught. That is one thing which probably Indian Medical Association, as a medical activist, I am against it. I am not against my own hospital, Max Vaishali, which I created as Pushpanjali Crossley, has a Ayurvedic doctor or has a homeopathic doctor. And their patients have a choice. If they want to go to Ayurvedic doctor, they can go. If they want to go to homeopathic doctor, they can go. They can go. There is no, I mean, and we simultaneously also want, I said in the beginning, that when Ministry of Ayush was created, it was created to develop those pathies, to develop research in those pathies. After all, there is no denial that Ayurvedic practice is probably ancient practice from which we have even emerged in our even modern medicine. There is no doubt about it. But where it has gone back, because of no initiative by the government or no initiative of the then government or today's government on this issue. And if you are trying to show data and you are trying to see, like Dr. Mishra has said, Banaras Hindu University are doing some surgical procedure which is known in this thing. I mean, we are not against it. If that surgical procedure is there, it's been done there. It is a surgical procedure which is very well documented there, it's been done there. But what we are against it, that this kind of a, like the circular came, the 68 type of surgeries will be taught for 6 months or 1 year to this thing, and they will be able to do that. Is something which we are, I mean, we say let the various pathies come to that level when it is possible. That has probably been our viewpoint, and maybe can be contradicted at any time and this thing. So I will request a very dear friend of mine, and we have shared debate on Coronil, and it started from Coronil. And I just want to inform you, one of the medical activists from Kerala, ophthalmologist KB Babu, has got an order from the court that all those misleading advertisements by Patanjali should be banned. This is a court order which has come last week, that all those misleading advertisements by Patanjali should be banned, and they have put a stay on all those bags. So that has been one our viewpoint when in various debates on that issue. So I'll request my dear friend Parmeshwara ji to please come and give his speech. Parmeshwara ji.
सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःख भाग् भवेत्। ओम धन्वन्तराय नमः। ओम शांति शांति शांति। मंच पर आसीन वरिष्ठ चिकित्सक, सामने बैठे मेरे बड़े चिकित्सक, मेरे साथी चिकित्सक, आप सभी लोगों का अभिनंदन, आप सभी लोगों को अभिवादन। सबसे पहले तो धन्यवाद देना चाहूंगा आप सभी का, ऑर्गेनाइजर्स का, जिन्होंने मुझे यहाँ पर निमंत्रण दिया और अपनी बात रखने के लिए समय दिया। मुझे गौरव है कि मैं आयुर्वेद का स्कॉलर हूं। आयुर्वेद एक ऐसा विज्ञान जिसको जब हम पहला चैप्टर पढ़ते हैं और हम पढ़ते हैं कि आखिर आयुर्वेद क्यों लिखा गया, तो एक सूत्र पढ़ने को आता है, प्रयोजनम च अस्य स्वस्थस्य स्वास्थ्य रक्षणम आतुरस्य विकार प्रशमम च। यानी कि इस विज्ञान, इस साइंस को लिखने का मेरा प्रयोजन है, नंबर 1 स्वस्थस्य स्वास्थ्य रक्षणम, यानी कि स्वस्थ व्यक्ति को कैसे स्वस्थ रखा जाए इसका विधान बतलाना। यानी कि अभी देखिए डॉक्टर साहब ने बोला कि प्रिवेंशन जो है वो बेटर एस्पेक्ट है हेल्थ का देन क्योर। तो जब प्रिवेंशन की बात करते हैं तो आयुर्वेद जो लिखा गया उसका पहला मकसद ही था स्वस्थस्य स्वास्थ्य रक्षणम। उसके बाद दूसरा मकसद था आतुरस्य विकार प्रशमम च, यानी अगर कोई बीमार पड़ जाता है तो उसकी बीमारी को कैसे दूर किया जाए। यू ट्रस्ट मी, आयुर्वेद हमने पढ़ा है, अपने आप में एक कंप्लीट साइंस है, अपने आप में एक तार्किक साइंस है। और प्रिवेंशन की यदि बात करें तो मुझे ऐसा लगता है इट इज द ओनली साइंस इन दिस वर्ल्ड विच प्रपोजेस द थ्योरी ऑफ प्रिवेंशन इन होलसम। अगर डाइट की बात करें, अगर लाइफ स्टाइल की बात करें, तो वी शुड बी प्राउड इंडियंस टू हैव आयुर्वेदिक विद अस, बिकॉज प्रिवेंशन की अगर हम बात करेंगे तो वी हैव आयुर्वेद विद अस, जो पूरी दुनिया में प्रिवेंटिव हेल्थ, जो आज बहुत मैंडेटरी और असेंशियल फिनोमिनन बन चुका है, उसको ऑफर कर सकता है. वी इंडियंस कैन ऑफर प्रिवेंटिव हेल्थ, प्रिवेंटिव एजुकेशन टू द होल वर्ल्ड. वी शुड बी प्राउड ऑफ आयुर्वेद. वी शुड बी प्राउड ऑफ आयुर्वेद. नाउ आयुर्वेद और एलोपैथिक मेडिसिन का इंटीग्रेशन जो सुनने में आ रहा है, अब ये इंटीग्रेशन वर्ड को डिफाइन करना बड़ा मुश्किल हो रहा है कि ये किस तरह का इंटीग्रेशन हम लोग प्लान कर रहे हैं. ये क्या इंटीग्रेशन मिक्सोपैथी है कि किस तरह का है, ये बड़ा क्लियर नहीं हो रहा. एंड बीइंग एन आयुर्वेदिक स्कॉलर, आपसे ज्यादा मैं वरीड हूं. मैं आपको पहले ही बता देता हूं कि आई एम ए प्योर आयुर्वेदिक प्रैक्टिशनर. आई एम प्रैक्टिसिंग आयुर्वेदा फॉर अबाउट 21 years and I treat almost 100 patients every day through pure Ayurvedic medicines. And अगर मंशा की बात करें, whenever we proceed for something, तो पहले हमें ये होता है कि intention क्या है. तो intention probably हम we go positive. Intention है कि health for all in a best way and probably by utilizing all available content. What I mean to say, एलोपैथ, आयुर्वेद, होम्योपैथ सबको इकट्ठा करते हैं so that we can give best to the society. That is the intention, which is good. अब उस इंटेंशन को एग्जीक्यूट करने के लिए we have to make a structure. हमें उसका प्रारूप तैयार करना होगा. अब जो सुनने में आ रहा है वो प्रारूप यह है साहब कि एलोपैथ के जो एमबीबीएस कोर्स हो गया उसमें 6 महीना 1 साल आयुर्वेद पढ़ा दिया जाएगा, so that they can also prescribe Ayurvedic medicines. And आयुर्वेद वालों को भी 1 साल के लिए, जैसे बताया कि 6 महीने 1 साल के लिए एलोपैथ पढ़ा दिया जाएगा, so that they can also prescribe the allopathic medicines. And to me, it is not acceptable. It is not acceptable at all. Why? Why? Because ना तो एलोपैथ और ना ही आयुर्वेद अब इतना छोटा रह गया है कि हम किसी आदमी को 6 महीने में या 1 साल में उसके लिए ट्रेंड कर सके. I studied Ayurveda for 8.5 years. 8.5 साल मैंने आयुर्वेद को पढ़ा. I did my graduation from Lucknow University, 5.5 साल. And then I did my post graduation from Banaras Hindu Vishwavidyalaya, BHU. 8.5 साल आयुर्वेद को पढ़ने के बाद भी you will be surprised. I think I know 10% of Ayurveda, जबकि मैं रोज पढ़ता हूं चरक को, रोज देखता हूं सुश्रुत को, रोज देखता हूं वाग्भट को, रोज देखता हूं माधव को, रोज देखता हूं शारंगर को, रोज देखता हूं भाव प्रकाश को. फिर भी मुझे ऐसा लगता है कि जब हम ग्रेजुएशन के टाइम पे हचिंसंस पढ़ते थे तो जितनी बार पढ़ो लगता था कि अरे ये चीज कैसे छूट गई थी, ये किस कैसे छूट गई थी. ऐसे ही. एंड यू विल बी सरप्राइज्ड कि आयुर्वेद इतना बड़ा है कि वास्तव में उसको 8.5 साल में भी अगर आपको बेस्ट में पढ़ना है तो नहीं पढ़ा जा सकता. इसलिए 6 महीने किसी को पढ़ा करके या 1 साल किसी को पढ़ा करके यदि हम आयुर्वेद की प्रैक्टिस करा रहे हैं तो ये गलत बात है. एंड वाइस वर्सा, सेम फॉर द आयुर्वेदिक डॉक्टर जिनको 6 महीना एलोपैथ पढ़ा करके आप प्रैक्टिस अलाउ करें. इससे नुकसान क्या होने जा रहा है? इससे बहुत बड़ा नुकसान होने जा रहा है. नंबर 1, हमारा जो क्वालिटी है, क्वालिटी ऑफ सर्विसेज, इधर एलोपैथिक और आयुर्वेदिक, वो डाउन हो जाएगी एकदम. नंबर 2, हमारा बहुत सारा रेलिवेंट कंटेंट. आई एम नॉट वरीड फॉर द एलोपैथ साइंस, आई एम वरीड फॉर आयुर्वेदिक साइंस. हमारा बहुत सारा रेलिवेंट कंटेंट हमारा पीछे छूट जाएगा. जब हम 6 महीने का कोर्स तैयार करेंगे तो बहुत सारी वो चीजें जो हमको समझ में नहीं आ रही. क्यों समझ में नहीं आ रही? बिकॉज दैट साइंस इज इन नैनोग्राम्स and we are carrying the weights in kilograms. We are incapable of testing that science. And जब हम किसी चीज को समझ नहीं पाते तो हमारी जनरल प्रवृत्ति होती है, हम कहते हैं ये इररिलेवेंट है, ये बकवास है, ये बकवास है. मुझे लगता है कि अगर हमने 6 महीने का कोई भी करिकुलम आयुर्वेद का तैयार करने की कोशिश की तो बहुत सारी वो चीजें जो हमको आज समझ में नहीं आ रही, बिकॉज ऑफ आर इनकैपेबिलिटी, वो विज्ञान हमारा छूट जाएगा. हो सकता है हम अगर प्रयास करते रहें, उसको रिसर्च में रखें तो कल हम समझ पाए. यू विल बी सरप्राइज्ड टू नो बहुत सारे ऐसे एग्जांपल्स हैं हमारे पास, थाउजेंड्स, जो आज साइंस नहीं बता सकता. फॉर एग्जांपल, एक हिंगुल है, मिनरल है हिंगुल. बेसिकली इट्स मर्करी सल्फाइड. जब उस मर्करी सल्फाइड को हम इम्प्योर कंडीशन में किसी पेशेंट को देंगे तो उसकी माइक्रोग्राम की डोज भी उस पेशेंट को लिए बहुत डेंजरस होगी। वंस वी प्यूरिफाई इट तो वो हमारे लिए लाइफ सेविंग मेडिसिन बन जाता है। एंड व्हेन वी सेंड द सेम सैंपल ऑफ मर्करी सल्फाइड इम्प्योर एंड प्योर टू द लैब, वो सेम रिपोर्ट देता है कि बोथ आर द सेम सैंपल्स, बोथ आर द सेम सैंपल्स। सर हमारे पास बहुत सारे पानी एक साथ पिया जाए या घुट घुट करके पिया जाए, दोनों के रिजल्ट अलग है। आपके हिसाब से तो पानी पेट में पहुंच गया 100 ml 200 ml व्हाटएवर, लेकिन आपने उसे पिया कैसे? दही खानी है, दिन में खाएं उसका अलग इंपैक्ट, रात में खाएं उसका अलग इंपैक्ट, सुबह खाएं उसका अलग इंपैक्ट। आप कहते हैं पानी एक छोटा सा टॉपिक लगता है, यू विल बी सरप्राइज्ड। आई एम द प्राउड डॉक्टर टू राइट ए बुक ओनली ऑन वाटर, ड्रिंकिंग ऑफ वाटर। मैंने किताब लिखी है पानी पीने के तरीके पे, पूरी मोटी सी किताब, बाई स्टडिंग अथर्ववेद चरक सुश्रुत भागवत। पानी की जब बात करते हैं, सी कितना डेप्थ है आयुर्वेद में। जब आप बोलते हैं कि पानी के क्या गुण है एंड बॉडी पे क्या इंपैक्ट है, वो बोलता है फर्स्ट टेल मी द सोर्स ऑफ पानी। ये पानी कुएं का है, नदी का है, झरने का है, बरसात का है। व्हेन यू से बरसात का है तो पूछता है आचार्य कि बरसात कब की, गर्मी की, सर्दी की या वर्षा ऋतु की। व्हेन यू से नदी का पानी है, बोलता नदी कौन सी, उत्तर से दक्षिण जा रही है कि दक्षिण से उत्तर, उसके गुण बदल जाएंगे, बॉडी पे इंपैक्ट बदल जाएगा। सो कहने का मतलब यह है कि अगर कोई चीज हमको समझ में नहीं आ रही, सी वी हैव सच ए वंडरफुल साइंस विद अस, सो वी शुड स्टडी इट, वी शुड स्टडी इट एंड गेट बेस्ट ऑफ इट, एंड उसको हम यूज करें हेल्थ फॉर ऑल में, प्रिवेंशन में एंड बेटर हेल्थ देने में वर्ल्ड को। हम उसको इग्नोर करके ना जाएं। सो मुझे ऐसा लगता है ना हमको अपनी क्वालिटी डाउन करनी चाहिए, ना हमें अपने कंटेंट को। एंड सी हम कभी कभी कहते हैं कि रिसर्च नहीं है। अरे चरक सुश्रुत भागवत उठाइए आप, क्या बिना रिसर्च के कोई आदमी इतनी मोटी मोटी किताबें लिख सकता है? आप जाके चरक में आप डायबिटीज पढ़िए, मधुमेह पढ़िए। जब वो बोलता है कि 3 तरह का मधुमेह है, सहज, कुलज और अपथ्यज। सहज और कुलज को आप कभी ठीक नहीं कर सकते, अपथ्यज को यू कैन क्योर। वो जवाब हम देते हैं कि कौन सा डायबिटीज, यू सेंड टू पेशेंट टू मी एंड आई विल टेल हिम कि तुम्हारा क्योरेबल है, तुम्हारा इनक्योरेबल है। दिस डायबिटीज कैन बी कंट्रोल्ड एंड दिस कैन बी क्योर्ड। सो एवरीथिंग हैज बीन रिटन वेरी क्लियरली। ये हमारी नाकामयाबी है, सिस्टम की नाकामयाबी है कि सरकार ने आयुर्वेद को प्रमोट नहीं किया। दूसरा, आयुर्वेद के कॉम्पिटेंट स्कॉलर्स को हम आज भी पैदा नहीं कर पा रहे हैं। आप उधर ध्यान दीजिए सो दैट हमें बेस्ट क्वालिटी एलोपैथिक डॉक्टर्स मिले, बेस्ट क्वालिटी आयुर्वेदिक डॉक्टर्स मिले, और वो दोनों डॉक्टर इवन होम्योपैथिक मिले, और वो एक छत के नीचे रहें। एंड एवरीबॉडी शुड बी मेक अवेयर कि तुम्हारी इस प्रॉब्लम के लिए, सर ने अल्सरेटिव कोलाइटिस का नाम लिया, सर अल्सरेटिव कोलाइटिस एंड इरिटेबल बाउल सिंड्रोम के कम से कम 10 पेशेंट एवरी डे आई ट्रीट, एंड यू विल नॉट बिलीव अल्सरेटिव कोलाइटिस के 90% पेशेंट्स को मैं 6 months to 1 year में क्योर कर देता हूं। सर क्योर कर देता हूं। सर वी आर ब्लेस्ड, सर वी आर ब्लेस्ड विद सच ए माइग्रेन। सर माइग्रेन के पेशेंट्स, सर 90% पेशेंट्स आयुर्वेद से 3 महीने में ठीक हो जाते हैं। सर बहुत सारे पेशेंट जहां पे सर्जरी इवन फॉर लंबर स्पॉन्डिलोसिस या सियाटिका व्हाटएवर आप आयुर्वेद में है। बस मुझे लगता है कि जरूरत यह है कि हम ये मिक्सिंग ना करें, इस क्वालिटी को डाउन ना होने दें, और आयुर्वेद के डॉक्टर को आयुर्वेद में बेस्ट कॉम्पिटेंसी दें, एलोपैथ के डॉक्टर को एलोपैथ में। एंड इफ यू रियली कंसर्न विद द बेस्ट सर्विस टू द सोसाइटी, तो आप एक छत के नीचे सबको बिठाइए एंड मेक अवेयरनेस की इस चीज में आप आयुर्वेद को दिखाइए बेटर है, इस चीज में एलोपैथ को जाइए। सो फॉर मी इंटीग्रेशन अगर 6 महीने हम पढ़ाते हैं तो दैट शुड बी फॉर क्रिएटिंग अंडरस्टैंडिंग, but should not be for practice. This should be for understanding, so that we each other can respect both the sciences. हम सब विज्ञान का एक सम्मान कर सके। तो मैं खुले मंच से कहता हूं कि मिक्सोपैथी हमारे लिए कहीं से हित की नहीं है। हमें आयुर्वेद को आगे लाना है, अपनी पद्धति को आगे लाना है। आप अपने कॉलेजेस के स्टैंडर्ड्स को अच्छा करें, आप कॉम्पिटेंट डॉक्टर्स निकालें, आप सफिशिएंट डॉक्टर्स को सोसाइटी में बिठाएं, आप रिसर्च करें एट द लेवल ऑफ गवर्नमेंट, और आप क्या कर सकते हैं, और आप फंड्स बढ़ा सकते हैं, वो भी हैं। तो इन्हीं शब्दों के साथ कि मुझे ऐसा लगता है कि इंटीग्रेशन का मतलब अंडरस्टैंडिंग एंड रिस्पेक्ट हो सकता है, बट नॉट फॉर प्रैक्टिस। थैंक यू वेरी मच।
थैंक यू परमेश्वर जी, वेरी एनलाइटनिंग टॉक, एंड आई एम श्योर आपके प्रति हमारा प्यार और रिस्पेक्ट और बढ़ गया। मैंने बहुत चैनल्स पे आपसे रूबरू होके नहीं बात की, बट मैं ईमानदारी से एक बात कहता हूं कि आपके प्रति जो हमारा रिस्पेक्ट और प्यार है वो कहीं ज्यादा बढ़ गया। आप जैसे एक्चुअली आयुर्वेदिक डॉक्टर हमको चाहिए। इस विचार के साथ मैं आपको एक छोटी सी बात के साथ आज डॉक्टर अशोकन की हम बात को करेंगे, जो हमारे की स्पीकर हैं। देखिए कैसे सरकार चलती है। हमने उनसे कहा कि ये जो क्वैक्स हैं इनको बंद कीजिए, एंड सरकार ने कहा बिल्कुल हम एग्रेसिव हैं, हमने दिल्ली मेडिकल काउंसिल बना दिया, दिल्ली मेडिकल काउंसिल उन क्वैक्स को बंद करेगा। और सडनली दिल्ली सरकार की तरफ से एक आया, मैं 90s की बात कर रहा हूं, एक स्कीम आई कि उन क्वैक्स को अगर 6 महीने की ट्रेनिंग दे दें तो उनको हम प्रॉपर ट्रेन करके डॉक्टर बना सकते हैं। दिस इज हाउ द गवर्नमेंट रन्स। लेकिन इसके बाद मैं चाहूंगा डॉक्टर अशोकन प्लीज कम एंड स्पीक, गिव हिज वर्ड्स ऑफ विजडम। डॉक्टर
Dr. Parameshwara has made my brief intervention very easy, because what all I had to say, he has said. We don't trust the government. It is so simple as that. We don't trust the government. That was the basis how IMA intervened in Rajasthan. There are so many things, intervention from Rajasthan, but IMA stood the ground, and that benefit is for the entire country. Similarly, the intervention in integrative medicine by IMA is for all systems of medicine. IMA has never demeaned any of the system. We have respect, esteem for all systems, especially for Ayurveda. All of us have some, the legacy, the esteem, it's there. But what we are against is very, very clear. Mixing. It's not done. We will not allow this to happen in India. The hard work of the doctors to raise the lifespan of an Indian. When the population was 40 crores, it was 27. When the population is 1.4 billion, it's 70. The interventions, I need not tell you, the vaccinations, the control programs, so many maternal intervention, the infant mortality rate interventions. We cannot mix systems because they are irreconcilable. Anyone practicing any system of medicine understands this very well. The government doesn't understand. I do not trust the minister. He has been polite to an audience of Indian Medical Association. I do not trust him. Because what the documents are there which have been placed speak totally a different story. The National Education Policy talks of medical pluralism. Have they defined it? They have provided for lateral exit and lateral entry in MBBS. The government is on record to say that in 2030, a modern medicine graduate will not exist. Only a hybrid doctor will exist. They are on record. They are on record. Different. Maybe there is a difference inside that. There are 4 full-time committees which have worked for the past 2 years to integrate medical curriculum, clinical practice, research, and public health and administration. There are 4 full committees. Go through those documents, what they are talking about. You cannot say that is co-location. This word co-location I am hearing for the first time. I think We will discuss about co-location. We have been having coexistence. Now you are suggesting co-location. We will discuss about it. We are ready to discuss with the government, especially with Sharad. Sharad told us that the government is sensitive about the word mixopathy. IMA has stopped using the word mixopathy. Sharad told us, don't show the example of China. The government is sensitive. Yes, because this is a national organization. That's a national government. The relationship is that we cannot run away anywhere. We are something like a husband and wife. We will always have issues. The national organization will have always issues with the national government. But there is no other way of sitting across the desk and talking out there. If the minister is going to stand by what he has said, I would ask all of you to document what he has said. He has said co-location, nothing more. Then it is coming down by the government. That's because of the resistance of Indian Medical Association. Mixing will be unacceptable. We draw the Lakshman Rekha for the government, for the health of the people. Patient safety, patient care is ultimate for doctors. We will not allow in medical curriculum to make MBBS. We have 660 medical colleges, 1 lakh doctors coming out of it. Let Ayurveda be pure. Let it exist as a science. And let it be the patient's choice. Even if the doctor is going to suggest, why don't you try this? I don't have any objection. IMA doesn't have any objection. It doesn't have. But you make one doctor who will be a jack of all trades. That is not going to happen. This organization is from the freedom struggle of India. We are not going to allow this government to mix all systems of medicine. That line is very clear. If you are going to change the national education policy, if you are going to change the 4 committees of Niti Aayog and your declaration of in 2030, there will be only MBBS integrative medicine, then if you are going on that, we are ready to talk. But mixing will not be allowed. No mixing in education curriculum, in clinical practice, or in public health. But in research, if you want to adopt best practices, yes, possible. We are open. We are a scientific community. We are open for that. We respect all systems of medicine. When, as IMA said, anything demeaning about other systems. When Ministry of Ayush was formed, did IMA say anything? For all practical purposes, please promote all systems of medicine, especially Ayurveda, is acceptable. Coexistence, we have been there for centuries. But mixing of system, the problem is we are mixing up with the health of the nation. We are compromising the patient safety. That perhaps under our assessment is one, that there is a sense of pride, false sense of pride. That may be one of the reasons. The second reason, most probable, is budgetary constraints in health, where they want to do, but that cannot happen. There are now adequate number of Ayurveda colleges are there, adequate number of modern medicine colleges are there. Why did, from NMC, what was a NMC struggle by IMA? The section 32. Section 32, empowering even an optometrist can practice modern medicine. Not acceptable. Section 50, section 51. These are the 6 sections which IMA fought against. 5 years, 2018. From there, now the government is saying co-location. Then why did you create these sections in NMC? Why did you create that? Why did you give that CCIM order for 68 surgeries? Why did you write in the national educational policy about medical pluralism? But anyway, if the government is going to stick on to co-location, I am sure Sharad will win. we are ready to talk. Thank you very much.
Thank you very much for this very, very important seminar. And I'm sure all the panelists and all of us agree on one issue, that we are not for integration, but we are for coexistence, or we are for a kind of a, that let all the pathies develop with respect for each other. And unless we develop that respect for each other, this topic will keep continuing. But that respect for each other, and if we have been, I have no hesitation to say as a medical activist, any ill conceived idea by the government of any kind, we have been fighting it for the last 50 years. I am in this association for 46 years now. Every time we have been fighting, 90% we have been winning, 10% we might not be winning, but we keep fighting. So if any such kind of ill-conceived idea government is bringing, let me tell you, like the Rajasthan government has bowed down on the private sector involvement in right to health bill on no terms as a right to the government. I can tell you that this government also, any government of the time, will not be able to bring integration of the kind which they are anticipating. And Indian Medical Association with the entire medical profession will go all out to oppose it. And any kind of association or assistance, if we require in our coexistence, or if we have been saying that give research funds, develop these pathies, open more centers. And I have given you one figure: in the last 3 years, only 8 medical colleges have opened in Ayurvedic, and 259 medical colleges, if you see, for so many years they are there. So if this is keep on happening, and they will keep on diversifying budget and keep adding, this thing will not be acceptable. So with this, I'll request our national president to give the concluding remarks, and then Dr. Sharad Agarwal, national president, please.
First of all, thanks to everyone who stay back here till now and participating in such a wonderful deliberations, because see, these kind of deliberations is very good for our knowledge also, for our thoughts process also. Just to concluding this thing, the integrative medicine. First of all, see, IMA is working as a advisor to the government. We are not for criticizing or fighting with the government. So our attitude is not to go against the doctor, but definitely for our issues, we will keep sending our resistance. So there is a difference between resistance and fight. So we'll show our resistance definitely. And as Dr. Asokan sir said rightly, probably they have shifted their mode from mixing to the coexistence. So I don't think that we have to stamp that yes, okay, because of our pressure. As per as a national president, I don't believe in taking credit that we have done. My priority is to doing the good thing for the fraternity, whether by mean of fighting, resisting, or by mean of communicating. So anyways, if they have come from mixing to the coexistence, and on record the minister said, so I think that is a win of IMA, and we should be happy for this. And we are vigilant also. If there is any issue, we'll again, we can go on the road also, but we are not saying that we are happy that they are seeing coexistence, and they agreed for that. And as Dr. Parmeshwar said, that is what we are saying, Dr. Parmeshwar. IMA is not against any pathy. IMA has no irritation with any pathy. We only want the purity of pathy. And we are against the cross pathy, and that is, in my opening remark, I said this in front of minister, that we are against the cross pathy. So probably because we hardly listen the speaker, but we speak what we want to speak. So I said it in the very first remark that we are against the cross pathy. We are opposing it, and we will keep on opposing it. But definitely, if there is an integrative approach, it is a very noble approach. It is a very good approach. And as an administrator, I know As Vinay sir said, that he is done in Pushpanjali. I, as a group medical director of Medanta, we did, even these many AIMS are doing it, there is no harm. Let the patient decide what patient want. And we respect all the pathy. With these words, thank you very much. I request everyone to stand up for national anthem. Okay. Before that, I request our HSG sir to please come and do the honor. Just a moment. रुक जाओ confusion. Momentos. Yes. IT का अरेंजमेंट है क्या पूछना है? पूछ के बता. ओके करो. सर सामने देखो. With these words, I thanks to my all team, Dr. Vinay Agrawal and Dr. D.R. Rai, Dr. Kshitiz and Dr. Munga especially for putting today's effort. And now we'll stand up for Rashtragan. Bharat Bhag Vidhata, Punjab Sindh Gujarat Maratha, Dravide Utkal Banga, Vindhya Himachal Yamuna Ganga, Uchal Jaladhi Taranga. Tab Shubh Naame Jage, Tab Shubh Ashish Mange, Gahe Tab Jaya Gatha. जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे भारत माता की. Please come for the high tea.